Good morning. We are going to get started with our Fssp meeting. I want to thank all of you for being here today in person and online. We're here today in order to review specifically the permanent rules that will move into public comment period beginning on November 1. But before we get into that, I want to start by talking through a few things that have I need to make sure to make clear. So as you all know, I've been on the job for just a couple of weeks and walked into this process at kind of the last minute right before this meeting and after the legislation passed requiring the promulgation of these rules. So I genuinely appreciate the hard work that's put into the draft by Cameron, by Kelly, Dr. Williams, and everyone that worked on it. But it is unfortunate that we didn't send it to you all until 3 days ago. That's not really enough time to really dig in. So what we've decided to do, given the magnitude of how the rules of this agency affect hundreds of thousands of Oklahomans, we are going to just discuss the permanent rules today, and then we will reconvene in October to discuss the emergency rules. So that gives you more time to review those emergency rules and gives us time to get the permanent rules moving through the process, because we are on a bit of a deadline put in place by the Administrative Procedures Act on those. So we will do better moving forward on our transparency. Make sure you are looped in much earlier next time so you have time to review the language of the rules. We are an agency that's only been around for 3 years, and we can't change how we started, but we can change where we are going and make sure that we are transparent and working with all of you in this room and listening to the voices of the folks in the industry and that are served by the OMMA. So in short, we can expect the permanent rules we discussed today will move forward to a public comment period opening on November 1. And then the emergency rules will be discussed at a special Fssp meeting in October that will be posted for the public on the OMMA website and the Secretary of State's website. So this will give you more time to review the emergency rules. Now let's go ahead and get started. You were sent the meeting minutes from the June 16th meeting via email from Cassie. So unless there is discussion needed, I would take a motion to accept the minutes from the June 16, 2021 meeting.
From the last meeting?
Yes.
I probably need to establish quorum and start.
We're going to pause because Cassie does need to establish quorum.
Yeah, just to have a record. Okay, Adam Austin.
Present.
Blake Cantrell.
Present.
Brian Duzan. Christy Edelin.
Present.
I'm about to call your name for to establish quorum. Mike Irvin. Here. Thank you. Brian Hendershot.
Present.
Wesley Holloway. Philip Jurina.
Present.
Michael Leake.
Present.
Carolyn Nelson. Norma Sapp. Here. Mel Woodrow. We have quorum.
Thank you, Cassie. So getting back to agenda item number 2, we are looking at the consideration of meeting minutes from the June meeting. Those were emailed to you with the agenda, correct?
Correct.
Is there discussion on the rules or on the meeting minutes? Excuse me.
I move to accept the minutes from the previous meeting.
I'll
Thank
second.
you. We have a motion and a second.
Was that Michael that seconded?
Yes. We also need to discuss the appointment of a chair and a co-chair of this committee so that I don't have to run this meeting every time. But we really do need a chair and a co-chair because that's how boards work. But
I need to go through, sorry.
Oh, we have to do that?
Yes, we have to, yes.
Oh, all in favor? Can we just do all in favor? All in favor say aye.
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 Opposed say nay. Okay.
I like it, thank you.
Sorry about that. I skipped
No,
that
you're fine.
very important step. All right, so co-chair and chair. We started the discussion back in June, but tabled the motion tabled the issue until this meeting because we ran out of time. So having brought it up at that June meeting, has anyone thought about volunteering to be the chair of the Food Safety Standards Board?
If nobody else will, I can.
Okay, Blake would like to put his name in for chair. So let's have some discussion or questions. Do we have any discussion around Blake becoming the chair of this board?
Do I need to make a motion to make Blake, I'd move to make Mr. Cantrell the chair of the board.
I second that.
We have a motion and a second. So all those in agreement say aye.
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 Opposed, say nay. All right, the ayes have it. Blake Cantrell will be the chair. Did I say your last name correctly? Okay, thank you. Now, we do need a co-chair to assist him with duties.
I'd move to make Mr. Austin the co-chair.
Okay, Adam Austin. We have a motion. Do we have a second?
Second.
Great. All those in favor say aye.
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 Opposed, say nay. All right, so we have Blake Cantrell and Adam Austin. We will follow up with both of you shortly to get you kind of set up to run the next meeting. And all right, so we need to discuss 2022 future meeting dates. We will file those with the Secretary of State by December 15th. That's a requirement by law. So Cassie lined out some dates that are all Mondays. And I don't have them on the screen, but I can just say them to you all, and you can hopefully follow along with and check your calendars and that kind of thing. March 7th, June 6th, September 12th, and December 5th are proposed dates for Monday meetings in 2022. Sure. March 7th, June 6th, September 12th, December 5th.
December 4th.
5th, sorry. I would take a motion to approve those dates as the 2022 FSSB meeting dates.
I move to approve those dates.
Okay, motion and a second. All those in favor say aye.
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 Opposed, say nay. The ayes have it. We will email those dates out and send you calendar invites to hold on your calendar for 2022. Okay, so we are going to move into the Food Safety Standards Board member updates. And I know that we have a couple of updates in the room, so I will first turn to Miss
Christy
Edelin, Miss Edelin. Will you please introduce yourself so that people online know?
Sure, yeah.
Who
So
you are.
my name is Christy Edlin. I am a pharmacist and clinical toxicologist for the Oklahoma Poison Center. And so as I kind of introduced in our last meeting, I feel like my charge here on this board is to just raise awareness, specifically of pediatric exposures that we're seeing that are actually going through the roof. And I have, can you guys pull up the infographic? It's also attached to your agenda. But you can see in that top right corner, basically our calls have skyrocketed, obviously, since legislation went into place. And so I just want to raise awareness of what's going on and a little bit more of our serious exposures that we've seen. I did not go ahead and put 2021 on the graph, since it's obviously not complete. There are some numbers down below that you can see that just since May of 2020, so May of last year, we've seen some pretty significant effects in these kiddos. And I can tell you that for 2021, we're going to far surpass that 140 exposures. So and then specifically in the last 4 months, we've had 23 kiddos admitted to the hospital, 2 admitted to an ICU. And then in the last 6 months, so earlier this year, we had some pretty significant exposures in really young kiddos. So these were kids that were placed on a ventilator or who required basically pressure support for their blood pressure. And then number of children less than 12 months. So, and that actually brings up a good topic. This is just kids less than 5 years of age. So this is not your 8, 10, 12-year-olds. This is young kids. And then also of note that I put right under the graph, these are just the exposures that are reported to the Oklahoma Poison Center. So if I had to guess, this is probably about half of what we're actually seeing as a state. And so, again, I feel like this is my big charge here on this board, just to raise awareness of what's going on. I think one of the big plugs, I know at the Poison Center, when we go out, and we're, granted with COVID, we're not going out as much, but when we do go out, our big plug is keeping these items up and away from kiddos. As you can imagine, they're gummy bears, they're cookies, they're brownies, and kiddos don't know better. You know, they just see it as a cookie that they want to eat. And so these kids sometimes are ingesting very large quantities of marijuana. We've had kids upwards of 1,000 milligrams. So as you can imagine, in kids, I feel like as a society, we've adapted this mentality, this but you didn't die mentality. Yes, thank goodness that I'm not reporting deaths here, but we also have to consider the psychological things that come along with these exposures as well. So just wanted to raise awareness. Again, this is for Brian and Adam. I'm going to be reaching out to you guys probably every board because I want this to stay an agenda item just so we keep it in the forefront of our brains. Yeah, I will welcome any questions you guys have.
I'm assuming that these are products that have been left about.
I'm assuming these are products that have been left about in the household, and then children get them and whatever and eat them. Just
exactly. So I think a big push for the board, for the state health department would be keep these items up, locked away. They are medicinal. And so I think that's part of the, part that people don't understand. This is medicinal marijuana. So we need to treat this just as though it's any other medication. So keeping it locked and out of reach of kids. It is, the other thing that I think is a good point to try to get out to the public is it is in child-resistant packaging. It's not in child-proof packaging. Just like any other medication, the medication bottles you get from a pharmacy, they're in child-resistant containers. If you give a child long enough, if you guys have young kiddos, if you give them a medication bottle, they will eventually figure out how to open that. It's just a matter of time. And so the thought behind child-resistant is in that time period, hopefully an adult is going to catch them and take it away from them before they get it open. And so, yes, you're absolutely right. So these are products that, for the most part, are being laid out. And again, kids don't know any better from their gummy bears, their gummy vitamins that they take every day from a marijuana gummy vitamin. And kiddos, when it tastes good, they're going to eat more. And so, like I said, we've had some kids that have ingested greater than 1,000 milligrams of THC. And so for kids, not only the medical aspect, but then the psychological aspect that brings along.
I've got a question. Are any of these, do you know, and you probably don't know this number, but any of these patients, or are any of them patients, OMA patients, these children that are having the reactions and overdosing, I guess, on it? Or
What do you mean?
Are any of your figures include patients, minor patients?
Oh, yeah.
because I've got a physician that's complaining to me about a minor patient with a card and not able to connect with the physician who originally prescribed it. So I didn't know if there any of these minor patients who were having these reactions.
I see what you're saying. I don't have that information. I would say by and large, just working the phones and through my experience, most of these are not going to be patients. These are going to be, usually those patients, hopefully, understand that is their medication. And so a lot of times, while it may be a therapeutic error, so I accidentally gave my child 2 gummies today instead of 1 or something like that, they don't tend to lead to this type of effect. So most of these, I would say, are probably not going to be patients.
Thank you for that update. Do we have any other board updates?
I guess I'll just, if you don't mind, briefly share the feedback I received from one of my osteopathic physicians who's licensed in the state. She's a pediatric physician down at OU and had reached out to me after a proper prescribing event, which is what we do when we talk about opioids, but reached out to me and said that she had a minor patient who had a marijuana card according to the parent. She asked the parent who the physician was. The parent refused to give the name of the physician. The pediatric physician in question was concerned because the minor patient was having, I guess, schizophrenia, was being induced by the marijuana, and she wanted to connect with the 2 physicians who prescribed it and was not able to, and so had reached out to us. I know she's reached out to DHS as well as OMMA, and so we haven't had any success in getting that doctor the information she's requesting. So I think it kind of goes to your report in a sense about the minor patients and the impact that marijuana has on them. And also I think that there's an impact on the physician standpoint when they're wanting to find out who prescribed this so they could maybe coordinate with that physician on patient care. Because as you point out, this is medicine. This is a medicinal product. And so, a physician should be involved in these conversations. And I don't think there's that ability right now due to the laws outside the control of the marijuana authority.
Are other pharmaceuticals, prescriptions, prescribed care, if someone were to see another attending physician, are they required by statute to provide that prior treating physician's name to the one they are seeing at that time? Am I making sense with my question?
I think you are, and it depends on the type of medication that's being prescribed. If it's a controlled drug, which marijuana technically still is a controlled drug, any controlled drugs 2 through 5 are required at the time the physician makes the prescription to be put into the PMP, Physician Monitoring Program, which all the doctors have access to. And we do at the board, we have access to the Oklahoma PMP. Now, a doctor can actually check the entire country. They have the ability to check into Texas and other states. But for a controlled drug, so say that minor patient was receiving a controlled drug from another physician, and then another physician came behind them, they should be able to get on PMP, search that person's name just with their name and date of birth, and it should come up and show that the prescription was written by a physician, and then if it was filled by a pharmacist, you'll also have that data in there. Obviously, marijuana is not on PMP, and so that kind of information is not relayed back. And I'm not necessarily advocating that that's put on PMP, but I think there should be an avenue for a physician to confidentially contact OMMA and say, I've got a minor patient who I believe has a card and there's some adverse impacts from the marijuana product that's being provided. I'd like to relay this information to the doctor that prescribed it and let them reevaluate whether it's appropriate or not. Right. Which I'd hope that a physician, if we're talking about hydrocodone or another controlled drug, if they were the subsequent physician who ran into this and said, oh gosh, well, you're getting hydrocodone and Xanax, hopefully no child ever gets that, but hypothetically, if they saw that concerning combination, that they would then call that originating prescriber. We would hope that would happen, but not always does it.
Is there anything that would prevent a physician from contacting OMMA in the exact circumstance he just described? Is there anything in law that would prevent that at this point?
Mr. Irvin, I'm not sure. I would have to look into the law, but I'm going to defer to Cameron to see if he knows.
So typically, any patient records are going to be sealed records. However, the only people by our rules and statute that can have access to those records are the patients, their guardians, or the physician. So there should be a mechanism there.
And like in the case that I brought up, the parent or the guardian was uncooperative, failed to give that information to the to the pediatric physician at OU. And of course, this is a minor patient, so they probably have no clue who the doctor was, where they're getting the stuff. And so there's that breakdown there. And in Ms. Berry's defense, I hadn't brought this up to her since she took over. This was something we brought up a while back. So sorry to catch you flat-footed on this.
No, totally fine. I'm going to get caught flat-footed more, I'm sure. But I'm making a note to look into this issue because I think that that's an important one for us to continue a discussion on.
And I could forward you my original email I'd sent prior, and actually has the contact info for the physician in question as well.
Thank you. Do you have any more questions, Mr. Irvin? Okay. Thank you. Do we have any other board updates that we'd like to discuss today? We do have 2 new board members that have been added. We have Brian Hendershot, CEO of Stash House Distribution. Thank you for being here. And Wesley Holloway from WHTC Holding. He was not able to attend today, though. I'm going to pause for a second and get off the agenda just to say that we are going to have the opportunity to add some new members after November 1 based on legislation that passed. So we'll be looking at adding, I believe, 6 more members. And we will need to have a discussion about that with, I believe, the community at large on who those seats should be filled with. So our next meeting in December, we will have 6 more board members here. Okay, moving on to, oh, yes, Norma.
Thank you. So I don't know for sure if this is the spot to bring this up, but I was made aware of people in Texas who have been recommended cannabis. They want to be able to come here and get a temporary card, and there's something standing in the way of with our policies.
Yes, actually, last week, Dr. Pasternak reached out to me specifically about that, and I touched base with Cameron and the team to find out what the issue is. We are going to be sitting down to look at the language of the statute later this week because I think it is a matter of the interpretation of our statute, whether or not that's an actual, whether Texas has an actual medical program and whether they recommended the use of marijuana. I think it's been a little hazy since their program's so different than ours, but I do think that there's room for discussion on that.
They do have a medical program. It is established, and they do have a couple stores that people can use. The problem is they don't have a card.
Their prescription or their recommendation stands as their card, right? I'm going to be discussing that with Cameron and his team later this week, specifically what you're asking. So we'll make sure to follow up and communicate that out.
All right, thank you.
Thank you. All right. Program update. That's me, director's update. All right. Well, 2 weeks in, let me give you my update. Honestly, it's been a great 2 weeks, getting to know the staff and how things work. So I appreciate the opportunity to come in and work with the OMMA and all of you. So just a few high level points I want to talk about right now, since that's kind of where I am. I'm high level as I'm digging into the details more and more each day. One priority is absolutely staffing up. A lot of our issues fall back to the reason of not having enough staff or not having the appropriate staff in place to assist with inspections, for example, and staffing up our legislative department, our legal department on the rulemaking side. So that's a large priority moving forward. We also are going to have our own dedicated legislative liaison this next session, working just with the OMMA. This will be the first session that we've had that. And I think that that's a positive for everyone involved because it's someone whose eyes will be on all medical marijuana-related legislation and be proactive on the communication regarding what its impacts are on the program, on patients, on businesses. So we will be out at the legislature having a more active role in the legislative process this next session. And we're working on our legislative agenda. That should be what we discuss at our December 6th meeting, as a matter of fact. So we will go over that and get your thoughts on that on December 6th. Let's see. So we are also, another big priority that the team was already starting to work on, and as I come in, I'm just kind of helping connect with the right folks at different agencies and associations. But we're really working on our engagement and getting out and making sure we're working with the right agencies. So for example, DEQ, we need to make sure we are communicating with them as our inspectors go out. If they see something that DEQ should be aware of, we need to know who to call and make sure to pick up the phone and be in communication with them. Same with Department of Ag, same with law enforcement. And we do have a couple of law enforcement officers on staff now. They are not fully CLEAT certified through us just yet. We're working on that piece, but they have been able to go out with OBN to see what's going on out in different parts of Oklahoma, and we're able to be present on and assist with a bust last week in Depew of a licensed grower who was purportedly or allegedly shipping product out of state. So I'm excited about that. I think it's important that we do have some folks with some law enforcement background, since we're seeing so much illegal activity in Oklahoma. That's not necessarily our mandate as the OMMA to go shut down illegal grows. You know, we are here to work with the licensed grows and licensed dispensaries and patients. But I do think that we can strengthen our relationship there to move forward and make sure we're helping in any way we can. We want to make sure that we are being open and getting as much feedback as possible from the community. So we're looking at ways to increase our Facebook and social media use so that we're communicating and getting feedback from all the folks out there. And I think that's an important piece, because we do have a lot of people that make comments and ask questions on our Facebook, and we're going to make sure to ramp up our efforts to actually answer those questions and engage in those conversations. I think that basically that's really, those are my high level at this point. We are working on a unified mission statement for the OMMA, so that every time we are out talking to folks in the community, we are all on the same page about what we do, which is we regulate the licensed businesses and the patient licenses in Oklahoma, and we work with the patient community to ensure public safety and public health for all patients. So with that, I'd like to open up for questions. If anyone has questions about my vision or has suggestions on items I should be looking at as the new director. Norma.
Did you say you were contemplating putting like an OBN agent on this board? One from law enforcement?
I'm not sure, not necessarily on this board, but we're just strengthening our communication with them. Are we? Oh, we do, yes. Mel Woodrow with OBN is on this board. He just is not here today.
Okay.
So at the last special meeting, Dr. Williams had said that the goal was to reach 100% inspections on all license holders. Can you give us an update on where that is, as well as the higher-ups that we had discussed?
Sure. So as far as getting to 100% this year by the end of 2021, we have had to shift that goal to by the end of 2022, 100%. We are working on getting inspectors in to interview so we can get them trained, and we're hired we're working on the contract with a project manager who that's going to be their entire job to bring these folks in and get them trained. And we're going to do kind of cohort programs where we do hopefully 8 to 10 at a time so that they can be getting out there to do these inspections. I can't speak for what happened before 2 weeks ago, so I can tell you where we are right now, and we're going to shift that goal. And I absolutely want to see 100% inspection next year.
Can you talk about the inspectors? Are those different from the law enforcement guys? And are the inspectors armed, or if they aren't, when they do go into dispensaries, which we know are very heavily armed, full of cash, do those folks have any kind of protection whenever they go in there? I know when my two investigators from the osteopathic board are both armed, and I know that sounds kind of crazy, but we have had situations where we've gone into a doctor's office where they were shooting off guns, and that happened to be next door to a dispensary as well that they were running. But so just wanted to ask that question to see if they were armed.
Sure. Yeah, our inspectors are not armed law enforcement officers. They are compliance inspectors. So they are the people who go out and make sure that businesses who are licensed by the OMMA are following the law, following the rules that are in place. There are checklists basically that they follow to make sure that they're following the law. So it's analogous to a food inspector that goes out to a restaurant or a bar and makes sure that they're following the laws. So you bring up a really good point, and we're at the crux of making sure that we have enough inspectors, number one, but ensuring that they are safe when they go out to these facilities, number two. So that's where we do have a couple of law enforcement on staff right now that in the future can go out with them. But the other piece is strengthening the relationships with the local law enforcement so that we can call a sheriff's office or a local police department and say, okay, we're going to go out here. Can you accompany our inspectors? Because we have intel that this is not a safe place for them to be. We do send people out 2 at a time at least. And that's another piece of staffing that we have to get extra staff just to ensure that everyone is staying safe and accountable to one another. To one another. But that's interesting that you have armed investigators. That's good to know.
How many total vacancies do you have, and how many of those are inspectors?
I can't tell you the exact number of total vacancies. I got it last week, but it's around, 100, 90 to 100. And about 45 of those are inspectors.
Is there a particular part of the state that's in more need?
The whole state.
Whole state.
Yeah, we want to go wherever we need to go in the entire state. But we are planning to set up the districts, so we have people in every part.
You'd mentioned Depew bust. How are you all identifying and prioritizing, tips you receive, or how do you go about identifying bad actors, and how do you prioritize which of those to tackle first?
Well, I will tell you that the tips mostly go to OBN, or if we receive them, we communicate with OBN. But that's where the relationship and the communication, basically we talk with them, they call. I know Taylor, who's behind me, receives phone calls from them pretty often, and they're in constant communication about what's going on. They can't give much of a heads up on when they're going to do a bust because they don't want to let the word get out, but they've been really good about letting us know if it's a licensed grow and we need to be in the loop, and that's what happened last week in Depew. But as far as prioritizing, I would defer to one of the folks that have been here longer than me to answer that. Scott or Taylor, do you want to answer that? Okay.
Excuse me, the chairs are fighting back there. My name is Taylor Harton. I am Director of Compliance and Enforcement at OMA. In terms of non-illegal activity tips, usually we run it through a measure of urgency and public safety, with public safety being the number one factor. So if we're hearing reports about something toxic, things like that didn't have testing, that's usually where we pivot and prioritize highest. We also have to be careful, too, because sometimes people will call in things on a competitor, and we want to make sure that we're not being baited there and treating everyone fairly. So there's kind of a matrix that my staff runs it through. Thank you.
Any other discussion or questions over?
Yeah. Of the, I don't remember the number, you said 40 some odd inspection personnel that you have on staff. Are those dedicated OMMA staff, or are those shared with the health department who also have other duties other than OMMA duties?
That's a good question. And right now we only have about 24 on staff, so we need to hire 40 something more, but they are OMMA dedicated employees.
They are dedicated to OMMA.
Yes, sir.
And we expect that number to rise to where I think I remember a 72, 74, 76 sort of a number.
Yeah, the legislature mandated at least 62, and so that's where we're starting, but we also have room to hire more than that if we find good folks.
And those will all be dedicated OMMA staff and not
Yes,
other
sir.
duties? Okay. And then those will be non-firearm carrying personnel. And I would encourage that, just as I don't think the industry, I don't think the state intended OMMA to be a law enforcement agency. Had they thought so, they probably would have found another place with an agency that does have badges and guns to go out and enforce these laws. And as you're well aware, that OMMA has civil authority rather than criminal authority. And so any prosecution of a violation of the statutes would be done as a civil matter as opposed to a criminal matter. And it just doesn't seem like it would be good relations with the industry, with the public in general, for civil enforcement to be carrying badges and guns. We all want our inspectors to be safe, and certainly there are protocols that can be instituted that can help improve that environment of safety for those inspectors, and we certainly want to take all those precautions. But I would encourage OMMA to keep the firearm carrying staff to a very minimum.
Thank you. I hear everything you're saying and have been trying to balance what the legislature mandated with what we need to do moving forward. And they only mandated 4, I think, enforcement officers at this time by the end of the year. And so I believe by the next meeting I'll have a better update on that, but thank you for the thoughtful remarks.
Pretty sure I know the answer to this, but I have to ask, any updates on metric implementation?
The only update I have is that the court in Okmulgee allowed it to be transferred to Oklahoma County, and I checked late last week. I don't even know if it has been assigned to a judge yet, but that lawsuit is now in Oklahoma County, and that's really all I know. All right, do we have any other discussion or questions for now?
Before we move on to the next one, I mentioned I'm going to have to leave in a few minutes. Will we still have a quorum? That won't mess up the quorum, will it?
Thank you for checking on that, yes. Okay, moving on to number 7. We are one moment, please. I need to double check on what this is. I'm going to turn it over to our attorney, Cameron Capps, to discuss number 7, the update on Fssp recommendations for proposed emergency rules from the June meeting.
Okay. So from the last meeting, I was not here, but from my understanding is that we had 6 recommendations that were formally made. And so I just want to quickly go through those with y'all, kind of see what we did, what we accepted and put into the rules, and what we did not and why we did not. So the first, and can you turn it over to the Should be the next one. Yeah. Okay. So the first recommendation that I have is that there's a request to add or reflect that laboratories are involved in the process for the state inventory tracking system. So we did not make any changes on this item. And the reason why that language came from statute, and essentially labs are going to be reflected through this definition because it accounts for all medical marijuana from either the seed or immature plant stage until the medical marijuana product is sold to a patient. So in between that process, it's going to go through the growers, processors, the labs for testing. And so all that's going to be accounted for through that definition. And so we just kept it consistent with the statute language there. The only specific business there is research, because research is a potential opposite from being sold by a dispensary to a patient. But labs will be included within this definition. So we just kept it with the statute language. Any questions there? Okay. So the next one that I have that was recommended at the meeting was there's a requirement for written standard operating procedures outlining the manner in which the commercial licensee operates. There was a recommendation that this might be a little bit vague. And so to add the language as prescribed by the authority, we went ahead and accepted that recommendation. We just did as prescribed by the department because that's consistent with our language throughout the rules. But we did put that in there. Any questions? Okay. So the next recommendation that I have is under. Okay, that has the wrong site. But anyway, under the language, it requires that dispensaries, processors, growers, transporters utilize an electronic inventory management system. And so the request was that we make this language consistent with 3-6, because in that language, I don't have that language in front of me, but it just talks about electronic manifest. So we took the recommendation, we put that commercials, transporters, growers, processors, and dispensaries shall utilize the state inventory tracking system in accordance with OAC 310-681-5-6D. The recommendation was for E, but D actually talks about shipping manifest in there. And so we took that, but we just changed the site just a little bit. Are there any questions on that one? I know that one was a little bit more confusing because we don't have the inventory manifest language up there. Yes.
So I know we, talked about this before, but I've become aware of something else too. And I read through, all the notes yesterday from how they're supposed to handle it, the transporters, and how if they have a product that is declined, how they are supposed to report back. But I've also been made aware of people that transport from one side of the state to the other. When they get to a new destination, a new dispensary, that dispensary might order more than they thought they were going to or something, and there's no way for them to carry it with them right now, extra.
Okay.
So you're discussing the transporters?
Transporters, yes.
Okay. Do you think we want to discuss that when we get to that part of the permanent rules?
Yeah, I think that would be a better place to discuss that.
I think
There's no
we'll be.
concern-
Sorry, I think we will have an opportunity to discuss, to open up discussion on that in just a little bit. Thank you.
All right, thank you.
Oh, no, you're good. Okay. Okay. The next recommendation we had, there's a little bit of confusion with regards to the requirement in 310-681-5-6F2 that all licensees must reconcile all on-premises and in-transit medical marijuana and medical marijuana product inventory each day at the close of business, but then also with the language that requires inventory to be tracked and updated after each sale and reported to the authority. So we didn't change anything with this. We still kept the language that all commercial licensees must reconcile at the close of business. And kind of the difference here is, one, you have the inventory tracking that you have to either have the real-time integration with the state's inventory tracking system, and if you don't utilize a seed-to-sale system that has the real-time integration, then you have to make sure that it's inputted after each individual sale, as required by the statute. The reconcile of all premises and in-transit medical marijuana at the end of the day, that's going to be a little bit different, as in, so at the end of the day, you just have to reconcile your inventory and making sure that everything looks correct and is updated at the close of business, as opposed to the reporting requirement into the seed-to-sale system.
May I add something to that?
Yes.
So at the end of the day in a grow, there is no end of the day in a grow. Can this also be reported like once a week, or make sure it's updated for the month? Because you are on duty as a farmer 24 hours a day. It's hard to take that time to sit down and report everything that you did that day.
So that's a good point, and that might be something that we change the language a little bit to reflect, instead of close of business, potentially a time frame, because I think that the intent there, though, is each day you reconcile.
Right. That's a couple of hours of sitting down time, and you've already worked 20 hours that day.
Yeah, I understand.
Let me see if I'm understanding, because I think I'm not understanding something here. My understanding that section applies to sales. So I have 3 units of X in my inventory. I sell one of them. So now, at the end of the day, I have to show in the system that now I only have 2 units of X, and one of those has now been sold. So at the end of the day, I have to show my sales. Is that not what that is saying? And whether it be inventory of whatever licensee's product might be, is that not what that's saying, or am I misunderstanding the intent of this section?
Do you want to hop in on any of this as well? Because I know, but I believe I might need you to repeat your question, though, because I believe I'm tracking you.
So this is talking about, this is in reference to the track and trace system, correct?
Right. The state inventory tracking system.
And we're saying it has to be updated by the end of the day. So I know in my operation, I have everything in inventory that I have.
Mm-hmm.
And so if I make a sale today, and I sell a unit of X product, I put that on the tracking system, that automatically deducts that 1 unit from my inventory. It says that I have now sold it to ABC customer dispensary, and so now I have 1 less unit in my inventory, and now I show that I have sold 1 unit to ABC dispensary. And that has to be reconciled at the end of the day. We do it, I don't want to say in real time, because,
right.
But we have to have the invoice and the manifest, so it's done.
Right.
So what is that saying, that I have to download that? If we're talking about a track and trace system, when I enter that, it should go into the track and trace system,
right,
unless I have some, which happens from time to time, the internet system goes down, or something happens that it can't communicate.
Right.
So at that point, I've entered it, it's in, I've done what I'm supposed to do, but I can't help the internet company get their internet back up.
Right.
So how does that, explain that
Okay.
to me, I guess is what I'm asking.
Yeah, and there's going to be a separate provision as well that came with the last emergency rules that also specifically applies to when your internet is down, giving a little bit of extra time there of how to go about that process. And so, but I think like you're hitting it on the head. So your system automatically integrates, and so it's going to be showing in your system. It's just reconciling that it is correct, and so it should be correct because it's integrated. It's done all that, and so please correct me if I'm misstating anything because I'm just the attorney here, and I'm not the one that's going through all the details with metric, but.
I don't believe you're misstating anything.
Okay.
And I believe your understanding is correct as well, sir.
Okay.
I believe that the conversation around this, at least from my perspective, was related to the double reporting requirement as I view it in F1 and F2. F1 is at a minimum, commercial licensees shall track, update, and report inventory after each individual sale to the department in the state's inventory tracking system, followed by 2, all commercial licensees must, not in the event that there's a maturity in the plant or that is a mandate, must reconcile all on-premises and in-transit medical marijuana product inventories each day in the inventory tracking system at the close of business. I think the conversation was related to the fact that we are in real-time reporting per F1.
Right.
So I understand the circumstance that F2 would give rise to, and I think that should be accounted for, but this is a mandate.
Yeah.
So what does that look like for me as a dispensary owner who I'm reporting each sale as we go, and then at the end of the day, to Mike's point, I download something or what? I mean, this is a mandate. We have to do it. I understand that that's not the circumstance that was contemplated here, that it was the maturity in the plants primarily, but that's not fixed by not accepting the recommendation.
Okay. So just kind of go back with the double reporting requirement because I think there's kind of a misconception as far as your real-time reporting is putting all the sales into there. And so at the end of the day, it's just reconciling that your inventory is correct. But
define that.
Huh?
What does that mean? Reconciling that our inventory is correct.
I'll jump in here. Essentially, by correct, meaning that what you say you have on hand is in fact what you have on hand. So in the instance where you are a dispensary conducting sales, if you're entering those into your POS that's integrated real time, then by the end of the day, that's going to be reflected because let's say you did it at 2 p.m., let's arbitrarily call the end of the day 5 p.m. If it was done at 2 p.m., then there's no need for re-reconciliation because it's accurate at that time. And to the point that you made, that is more relevant for sales. There might be harvest, plant shifts, plant tags, plants wasted, things like that that would not be reflected in a sales capacity in the same way that we wanted to make sure we captured here.
So Taylor, you're saying if it's real time and it's updated all day, he does not have to file another report at the end of the day per this rule?
That's my understanding, yes.
If that's the intent, then I think we do need to change that must language.
Okay. And I think that must was just to ensure that people are reconciling every day because not everybody's going to have that real-time reporting. And so there's going to be the potential option where people have to actually go in and manually input stuff. And so it's just ensuring that, like you have that after each sale, that people are actually reconciling. They must reconcile that at the end of the day.
And I understand the need for it. I'm not, debating that it needs to be in there. I'm debating that it be clarified because, as it sits, it's a mandate to every license holder to, in effect, double report for those that do not have a need to, take in inventory at the end of the day because we've been reporting in real time.
Okay. So your suggestion would be to, I think I'm following you, but to clarify more for if those who are not automatically going into where it's going to be reconciled anyways and accurate, to clarify exactly who that would apply to.
Sure. Something to the effect of, in the event that there are any changes in state of, cannabis or any unreflected due to internet outages, what have you, then at the end of the day, it must be reconciled in that event, not report in real time and also every single day run inventory.
I hear what you're saying. So it sounds like we just need to make it clear that if you're running it in real time, there is no need to do a separate document at the end of the day. So
Meets the requirement of the end of day.
Yeah. So we'll definitely look into that.
Or things, yeah, you could make it to where if you meet one, then by default that makes you meet two, and you just have to word it that way.
Would this be a formal recommendation that we need to motion, or I know we're reviewing from the prior, but
Yeah, so I don't think that this would be the time because under the agenda we don't have it for but I'm going to make this note, and then there might be a potential that when we go through these permit rules, we could go ahead and just hit that, and that way we can get a formal recommendation on the.
yeah, that's my thought. Just make a formal recommendation when we get to the permanent. Yeah.
thank you guys.
Okay. So the next recommendation that I have is that there was a request to make consistent that anytime we say days, to use business days. We went through and accepted this recommendation to the extent possible. So there are certain requirements under statute that apply to calendar days as opposed to business days. So when that's the case, I mean, we can't change that. But also we have our NOV requirements where you have 30 days. So with NOVs, it just wouldn't make sense to do 30 business days for our compliance team. But other than that, when we had the ability to make it consistent, we did make it consistent through our rules. Any questions? Okay.
I just think as long as it's made clear, whether it's calendar days, business days, people know that if you just say days, they'll know whether it's calendar days, business days, I don't know. Just as long as the information is provided.
Okay. Thank you. Okay. And then the last one I have, I think we kind of just already touched on this. Supply action item 2 to SOP language in every subchapter that it would apply to. So that is done.
Okay, so those were the changes, recommendations made by the FSSB at the last meeting that were incorporated into our emergency rules. And then on number 8, the discussion on possible recommendation for proposed emergency rules. Just for good governance and allowing you all to have more time to look over those emergency rules, I would accept a motion to table number 8.
Or yes, I'll make a motion.
Okay, motion.
Second.
In a second, all those in favor of tabling number 8 until an October special meeting, please say aye.
Aye.
Opposed, say nay. Ayes have it. We will table number 8. Move on to number 9. Well, we don't need a recess for lunch at this point. We can add that in wherever we need it. But if we would like to take just a 5-minute recess for human purposes, there is a coffee shop on the ground floor, formerly known as the basement, and restrooms. So let's just recess for 5 minutes. Do I need to have a motion for that?
I don't believe so. Do we need a motion for recess?
Let's just recess.
Yeah, I'll write it down. I'll time us. Recess at 10:02.
Recess until 10:10 a.m. All right, I'm a few minutes late, but let's go ahead and adjourn again, 10:14 a.m. Cassie, will you check for quorum, please, after our recess?
Adam Austin,
Present.
Blake Cantrell,
Present.
Christy Edelin,
Here.
Mike Irvin, Brian Hendershot,
Present.
Philip Drina,
Present.
Michael Leake, Norma Sapp.
Here.
We have quorum.
Great, thank you. So we are moving on to number 10, which will be the meat of the conversation. Excuse me. All right, so on Friday you received an email with the recommendations for the proposed permanent rules. And again, I will kind of go over why we are looking at permanent rules today, but not the emergency rules. I know it's a little confusing, but we had both of them kind of pushed into this meeting for today, and it was my decision to separate those out because I think that that's too much. It doesn't give you all enough time to review all of the rules. However, we aren't able to go backwards on the permanent rules because of a timeline that we are under from the Administrative Procedures Act. So we have to move the permanent rules forward more imminently and get them through the public comment period, which will start November 1, so that we can get them to the legislature to approve next session. Does that make sense? Am I explaining it properly why we are doing a permanent rules today? And then the emergency rules, we just have a little more flexibility. We need to get them to the governor by November 1. That's why we can meet in October to review those and give you a little more time to formulate your own comments and suggestions. All right, so everyone received their copy of the 130-page rule document, correct? I didn't. You did not, okay. Well, it's in it's an email. Do we have another? She can have my copy.
It has Kelly's comments on it.
Oh, it does? Does this one? Oh, okay. I think that's fine. Norma, we'll give you my copy. Yeah. It is a lot to print, yes. All right, we will get started, and Cameron here has been working incredibly hard. Cameron and Dr. Williams working through these rules, so he is here to help explain some of these if we have questions, and if there are questions we cannot answer today, we will get back with you, but we will do our best. Right, Cameron?
That's correct.
Okay. Do you want to just take it from here?
Yeah,
okay.
absolutely.
Great.
And so, and then obviously with the questions, I have some people behind here that might help be able to answer as well.
Real quick, since this was new to me, what is the grayed out text?
So the grayed out text, there was a little bit of formatting issues. There's going to be some things that were an original document that when it was transferred over to this document, there's a grayed out text. So mainly what you're going to be paying attention to is the yellow highlighted text. Also, with the emergency rules, most of the gray out are going to be applying to the previous emergency rules, but there's going to be some different circumstances there. That's why I went through and tried it. When we had the emergency rules, I highlighted in yellow what was specific to emergency, and then this permanent rule document, I highlighted in yellow what was specific to the permanent rules. And so,
To clarify, so then the highlighted is changes since the last emergency rules review, and grayed out is what last meeting was highlighted. Is that correct?
No.
Okay.
But no, that's a great question because there's so many emergency rules that are floating in the air. So most of the gray out is going to be related to the emergency rules that are going to go in effect on November 1st. So what the other document that was also sent out. But there's going to be some formatting issues there that's not going to always be the case. Okay. So what I'm going to do is I'll just start going through them and just go through the highlight portions because those are specifically what is permanent rule, and those are going to be what is different than the other emergency rules. And so just to let you know, both the June 28th emergency rules and then also what will go as emergency rules, the other document that we sent, are both in this one permanent rule document. So that's why there's a lot more underlining than what is highlighted. Okay. So the first one that I have is just COA. COA is used throughout the document, so it's just putting right there that it's certificate of analysis. It's just a cleanup thing. And the next thing that I have is going to be under dispensary. This is going to be another cleanup thing. We just moved licensed caregiver to make it read easier. And then obviously the gray out part, that was something that was included in the emergency rule packet. The next change is going to be on page 11. Again, this is just a cleanup thing. Naturally occurring was missing in this document, so just added that.
And can we pause real quick just to verify that all of the underlines and the gray will be discussed at our next meeting, correct? Is that, unless they were from the June rules?
Right, unless they were from the June rules, and so.
Okay, so if you had comments on some of the gray and the underline, that would be the purpose of our October special meeting, is to get in depth with those emergency provisions that will go into effect November 1. So just wanted to clarify why we're skipping so much.
Yeah. So is the gray going into effect?
So
that's just for our reconciling them.
Yeah, if you think about the timeline of the permanent rules, we have to get them organized and written right now and send them through the process. So ideally, yes, those will all be in the permanent rules that go to the legislature in the spring. But there are a lot of steps to jump through between now and then. So Cameron was thinking ahead of like what all will need to be given to the legislature. And so he put those emergency rules in there. But there's nothing today that will, these will not be put into effect until like a year from now, correct?
Right. It'll be next September.
Yeah, so it's this long drawn out process.
Yeah, and just to give you all a little bit more background of why I have to put everything in here is if I don't put what will go into emergency November 1st into the permanent rules as it goes through the public comment period, then those emergency rules will be superseded. And so I have to put those all in here to make sure that they remain in effect when these permanent rules come into effect. So, okay. So the next non-cleanup change is going to be right here on page 12. And this is just more of a clarification. It's just adding that transporters can store, transport, distribute, but they do not take ownership of. This is kind of consistent, or this is consistent with statute, but it's just ensuring that we've had a lot of questions about this. And so it's clarifying that the transporter is not taking ownership of the medical marijuana products. Any questions? Okay, the next changes just added real ID. So just as we move towards that direction, it's just like your driver's license or real ID, just more cleanup. So page 17, it's going to be a non-cleanup change. So one of the things that we've had is when a 100% permanent disabled veteran is applying for a medical marijuana patient license, a lot of times we had a requirement that you would have to have any of that documentation showing that disability rating signed within 6 months. A lot of these permanent disability, though, they get one card, and there's been a lot of frustration there. And so kind of what we did was just remove that requirement for 100% permanent disabled veterans. And so if you're a temporary 100% disabled veteran, you're still going to have to produce that documentation signed within 6 months. But
I want to back up just a second.
Yep.
I didn't get in time on the transporter. So a transporter would not be able to take ownership at all of any product.
Right.
So they would not then be a distributor, they would just be a transporter. What would a distributor, someone who wants to buy packaged units, purchase them perhaps on volume, get a better price, and then resell that to the dispensaries and make a product a profit in the middle? What would those persons, those entities, those companies do? What would they have to do in order to qualify? Would they have to get a processor's license, or what? How would they be able to take ownership of that product, or
So-
could they?
That would be a potential route, and but the route would not be for a transporter license, and that's what I can say as far as how they do that. I know there was appetite originally in legislation for a distributor wholesale license to do that very type of thing. That did not go through, but kind of the example you pose is a potential option.
And to clarify, so back to what Mike said, so that is intended to disallow a transporter from taking title to a cannabis product?
Correct.
Okay.
Okay. Good to move forward? Okay. So did anybody have any questions on page 17 with the documentation for 100% permanent disabled veteran? Okay. So the next change is going to be page 25. This is just a record-keeping requirement that you have to keep your GPS data and records for at least 7 years. This just makes it consistent with what we've tried to do is the statutes have, in House Bill 2646, has made 7 years the record-keeping requirement length. And so we've tried to make that consistent with all records throughout our rules.
Okay, I had a question. This came up in a similar program. What if I'm open and I go out of business in 2 years? I have no license for you to take action on. How do we maintain that they have to keep those boxes for 7 years?
I mean, it's a great question. It's going to be hard to enforce that when you don't have a license, you don't have a premise, you don't have anything to ensure that they have that documentation. Do you have anything to add there, Taylor? Okay.
Okay, well, I was hoping you had an answer for
So,
me.
I mean,
Somewhere
for
else, but- okay.
licensees, you're going to be required to have those records. And so this is mainly going to be putting that onus on licensees. So,
Do you think this warrants adding a clarification for an out-of-business license holder? Maybe just make it the IRS 3-year in that event, or
sorry, repeat that.
should we make that clarification for a license holder who has gone out of business? Should we separately indicate that, for example, they just have to keep them 3 years like the IRS would require, or do you think that?
Here's the thing is potentially we could try to add that, but our authority over non-license holders, there is no authority over them. They're going to be outside of our jurisdiction at that point.
Well, then this does not apply to it.
Yeah.
There is a $500 fine for failure to make documents or request information available to the partner. But I mean, at that point, though, what's the point? I mean, why? You know? I mean,
Yeah. Okay. So the next change that I have is on page 48. So one of the issues that has happened and kind of what we wanted to make sure to clarify is that if you have multiple licenses at a single location, whether it's a processing kitchen, a vertically integrated business, is to make sure that you have all the inventory separately marked and distinct from other inventory of other businesses. That way, when our auditors or inspectors go out there, they can know which business the inventory is owned by, and so when they're performing that inspection for that specific license, they can identify whose product and inventory that is.
Does a metric tag suffice?
So you're going to have your metric tag requirements, but also the actual inventory is going to make sure to have it physically separated from the other businesses. Any other questions there? Okay. So on page 49, this is and this might not be, it might be in y'all's document. So in House Bill 2646, it allows us to charge a fee for any material change that would affect the qualifications of the license. And so those material changes are going to be ownership changes, location changes, and so changes that essentially we have to reprocess the license and have people do their groundwork there. And so in doing those type of material changes, kind of what has been proposed here is a non-refundable $500 fee if you're going to change ownership or locations. Only for material changes, correct.
So give me an example of something that would be not material change.
So any updating information into the website, updating hours, or some other examples.
Phone numbers, email addresses.
Okay.
So, but if one of the owners passed away, and that ownership was redistributed through the other existing owners, that notification would be a material change and would have to pay a $500 fee.
That's correct.
So I would just wait till my license renewed and then give the information.
And this is pretty standard across agencies that regulate, to charge a fee when our staff has to go in and
And there's been some big changes, so also ownership changes to where you can now transfer the entire license. And so now that people are able to do that, it's to help capture that fee. But
if I wanted to move my location,
but you are,
then I would certainly want to go ahead and make that material change as soon as possible.
yeah. Okay. Okay, just another cleanup, adding real ID to the information provided for applications. Page 61, this is another cleanup item, just clarifying that lab reports mean COAs. So COAs are records that all licensees have to have on their premise. Okay, the next change that I have is on page 75. So this is one that essentially minors under the age of 18 are going to be prohibited from any areas of the licensed premise where there's commercial operations occurring or where there's medical marijuana or medical marijuana products present unless it's a dispensary situation and they're there with a guardian.
What's the intent here? Like, easy example I can see where this being problematic is a small grow operation that is on their residence or on their property. I mean, what's the intent behind disallowing this when, previously Section A permitted it, to make a carve out for a dispensary? I don't understand the purpose, and it also appears to be conflicting with the preceding A.
So the intent there is, in that situation, that's why there's that specific language with the areas where operations are conducted. And so if they're in a residence...
What does that mean, though?
So wherever you are conducting operations. So if you're processing, you can't go into the processing area.
So again, in the example of a small grow operation, the children can't go in the backyard.
So, and again, that's one of the potential... The purpose was tried to clean that as much as possible, but this is also one that we would love to hear a little bit of potentially a recommendation on, or the feedback that you would have.
If I had a recommendation, it would be to strike it.
Okay.
I mean, A is sufficient in my eyes. Accompanied by a parent or legal guardian. I mean, this doesn't impact necessarily me as a dispensary. I'm just thinking about the, impact on a grow that's on their property or, in one of their rooms in their home. That means the kids can't go in there without risking a violation. That's why I'm asking about intent.
Yeah. I mean, so again, it's going to be where the marijuana and marijuana products are located.
What does that mean, though?
So a room where they're located. So, I mean, potentially there's clarifying language for home grows and home situations. That's a potential, or
well, I mean,
if it's a recommendation to strike it.
I'd like to capture the intent to the extent that there is any, but I'm not really hearing any. Was there a specific intent behind this that I'm missing?
I think the intent is to prevent minors from going to areas of operations.
Should that minor be accompanied with their parent or legal guardian, would that still not be okay?
So under this rule, as written, no.
And why not?
So, anybody have a specific?
I'd like to keep the intent to the extent possible, but I'm not really clear on what that is.
Was this recommended to us by a third party, or was this an internal discussion?
Internal discussion.
Okay.
I'm happy to speak to this. The example that comes to mind would be ethanol or butane extraction facilities where there are some concerns about a 6-year-old running around with all of these canisters or highly explosive or highly flammable materials. Similarly, as you all know, it grows, there are lights, there's CO2, there are things that can pose risk to minors. So that, I believe, is where the original intent came from.
Is that risk not offset by them being accompanied by a parental or parent or legal guardian? I mean, I understand the concern, but that's implying that OMMA license holders aren't, able to watch their children on their premises.
I can certainly say that that was not the intent. It's just even myself going out to some of these facilities, there are pesticides and things that can just be very dangerous. So I would be open to any motions that the board would have accordingly.
Yeah, there's also no specification that it even be during operating hours of the business. So the fact that an owner may have maybe a spouse and child come by on a Sunday afternoon on their way somewhere to pick something up or anything of that nature, they would be in violation of law or at least of the rule if the juvenile went inside the facility. In fact, it may even be a violation to drive up into the parking lot with that child in the vehicle. And Yeah, I mean, I just think I'm like Blake, as long as there's a parent or guardian there, I'm not seeing a lot of issue, but especially if there's in non-operating hours or in areas where there's, the actions are not happening, the processes are not taking place. I guess I'm seeing this as a little bit restrictive, unnecessarily restrictive.
And I understand that, obviously everybody wants to make sure that we're protecting minors. But in my opinion, the preceding A, the fact that they must be accompanied by a parent or legal guardian, combined with the, regulatory framework that you guys have developed to monitor and control a process specifically as well as a grow to, offset some of those risks, I don't know that this is necessary, because I think the impact of it means that for the person who has a grow at home, they now can't allow their children to do areas of their property without risking their license. So with that, I'd like to make a motion to strike B.
A motion to strike section B. Do we have a second?
I'll second it.
Second. All those in favor say aye.
Aye.
Opposed, nay.
Nay.
Nay. Can I have a comment?
The ayes carry. I'm sorry, go
Can I
ahead.
have a comment real quick?
Of course.
So the other option, sorry, we already voted on this, would be to change prohibited to must be in direct supervision or any other synonyms to where it's not just that you're in the facility with your parent, but your parent is, as a kid, you're leashed to them.
What if we added at the end of A, at all times while on licensed premises? To that point, what if we were to add at the end of Section A, no minors under the age of 18 may enter unless the minor is accompanied by his or her parent or legal guardian at all times while on the licensed premises?
I think that would get the gist of everything. I tend to agree that my kids can act like animals and be in row F while I'm in row A. So, yeah.
Or the other thing is you could have accompanied and supervised and just add two words to it. The other thing I would say on that is take out the his or her and put their, kind of like the other one, so it's all flows through and doesn't point out one thing or the other.
Thank you. So your suggestion would be just to, on section A, where it says accompanied, just add accompanied and supervised by their parent or legal guardian.
Yes, that would be the way I would word it.
Would that be okay? Do you have any comment, Christy?
I think that should be fine. So my thought is, again, with B, where ultimately, yes, you can nitpick as much as possible, but ultimately we're in this for protecting minors. And so I think as long as the supervision aspect is added in, then I'm fine with it.
And most facilities should have, I don't believe it's required by any rule or statute, but most facilities should have their operational areas separated from their administrative areas by key code, card code, biometric, some kind of limited access. And I know in our facility, you cannot travel from a public area to an area where processing might be taking place without having the proper keys, cards, et cetera. And so, having someone in our administrative area would be no different than having a child in this room. In fact, it may be less unsafe, that's a double negative, but could possibly even be more safe because we take great care to make sure that things are not trip and fall hazards, all of those kinds of things. And typically, any child coming into our facility would not be able to access those areas because we want to prevent any unauthorized person at any time from coming into an area where any processing might be taking place.
So it seems as though that should be something that's in the statutes, though, whether it's a key card, whether it's a locked area, whatever it may be. It kind of goes hand in hand in my mind as to why we should keep B.
I'm sorry, I guess I didn't follow.
So you went through, I guess, in your dispensaries or in your areas where there is product available, that there are key cards to access or, locked areas. Essentially, you were saying it wouldn't be available to kids. And so in my mind, that makes sense as to why we wouldn't, especially those kids. I'm really thinking, again, the kids under 5 that are arbitrarily walking in and saying, oh, a marijuana or a brownie or something like that. So that's really where my brain goes to, not necessarily kids that know better. I mean, we want to protect them too, but
Right.
Those inadvertent exposures. So should there be something in the statutes that say there should be a locked key card area or something like that to where these children would not even have access to that?
It does say this only applies to the areas where medical marijuana or medical marijuana products are present.
In my mind, this goes back to the small grow example. So what would that look like for a small grow operating out of their own home? They would have to create a secure area in their home, and which may or may not be financially realistic. Are we still okay with modifying A to accompanied by and supervised by?
I would be
Parent?
fine with that. If we're talking about a room inside someone's home, I see where you're going with that. So a parent must be there and accompanying the child and supervising the child as being in the statutes. Ideally, in my mind, a child of that age should not be in that area. So locked room, whatever it may be. What's to keep a 5-year-old from going in there and start chewing on a plant or something like that?
If I may, as a brief point of information, I believe that OB&DD, the Oklahoma Bureau of Narcotics and Dangerous Drugs, does have some requirements that speak to this in their administrative rules.
I think even these statutes do address it in some capacity. So I think those combined with the modification of the requiring supervision should hopefully address that concern. And I'm not disagreeing with you whatsoever, just trying to craft this in a way that doesn't, prejudice the small operation.
Just make sure that I missed something. The past few years, you cannot have a commercial operation in your home, right? Or has that changed? Because that was the way I recently understood the whole scenario.
Caregivers
On
could.
a farm, you could.
A caregiver could?
Oh, no, I meant like I couldn't have a commercial grow in my back bedroom because it's not separated from the living space.
I believe the only current prohibitions are for processors that are doing ethanol, butane, and other hazardous extraction types. Cameron, please
Yeah, so
interject
there's
if I'm
no
incorrect there.
prohibition on any commercial businesses operating out of a home. I think also the part that you might be thinking about is for the processors where they have to partition it off, but they still are able to do it in a residence, but for the butane, propane stuff in a residential area.
Yeah, the butane and propane, that makes a lot of sense because, it's dangerous. So, okay.
So I'll make a motion to add to A, unless the minor is accompanied by or under direct supervision of their parent.
Or legal guardian.
Do we have a second?
Second.
All right. So Adam made a motion to add some words to Section A that we have captured in our notes, and we will go over at the next meeting. All those in favor say aye, please.
Aye.
Aye.
And I
Opposed?
think all you would have to do is just strike in a retail area of a dispensary, right? That was all the,
I believe we voted to strike B, and we're just going to change some of the words in A, so it will read, no minors
Oh,
under the
okay,
age
I'm
of
sorry.
18 may enter licensed premises unless the minor is accompanied by and directly accompanied and directly supervised by their parent or legal guardian.
Okay, perfect.
So are there any nays?
I'm slow, but I catch up.
All right, the ayes have it. We can move on.
Sorry, one last thing. Just to make sure, though, I'm clear. Are we also adding at the end of the sentence of A at all times while on the licensed premise? I had that language written down. No?
I believe that's fine.
Okay.
I'm not sure if that's specifically what you said, Adam, but
That was part of the group discussion. I know I didn't say that. But
Okay. Okay. My apologies there. Okay, so the next one that we have is on page 76. Ooh, we'll go up just a little bit. Okay. So we've added a prohibition under the Prohibited Acts section that licensees shall not allow any other entity or person to use their OMMA license number who is not an owner, employee, or authorized contractor of the commercial licensee while conducting business on behalf of that commercial licensee.
Could you give me an example of what that would address?
So the examples I think that I've been provided is a transporter cannot conduct business as another business. And then we've also had potential situations where a lab has had other businesses try to act as that lab and use that license number on potential COAs. And so it's just saying that you can't do that.
So another lab conducting business in another area was using that same license number?
It wasn't even another lab. So just another business that was using the lab's license number.
Okay. This is so far, yeah, all right.
It shouldn't
way
be
illegal
happening.
stuff as far as
Yeah.
so yeah.
Well, and if you think about a transporter, they need to have their own license. So we don't want them using somebody else's license when they're doing their transporting.
When we say authorized contractor, what's kind of the definition of that?
So just somebody that's authorized to operate on behalf of that entity while they're working for them.
And the reason I ask that is just because, terminology of brokers go around and get other people's products, and then they're kind of representing that company, yet they don't work for them or W-2 them. I mean, are we saying that is it just authorized that they can do that, or should there be should they have an agreement with this company that we can transfer?
Exactly. So the situation where they'll have an agreement where they're getting compensated, but they're not actually an employee or agent of that
Gotcha. Thank you.
business. Okay. So the next prohibition that we've added here is S, just making it clear that simply you cannot infuse alcoholic beverages with medical marijuana or medical marijuana products.
Does that authorization come from the statute? I don't remember that.
So this is a prohibition that's not specifically addressed in statute. It's one that we're doing based on the safety and health aspect of things.
So we're looking at rules that are not authorized in statute?
Well,
If I may, I believe that the ABLE Commission already prohibits this on their end.
But no, we're authorized to make the rules in this section. It's just not specifically stated in statute that this prohibition is not specifically stated in statute, but we have the enabling legislation allows us to create rules around safety, public safety, and public health.
and just also to add to that, though, you already cannot have alcohol on your licensed premise in the first place. And so that's going to be a prohibition that's already going to be applying to this area, as well as ABLE Commission. And this is a very common prohibition throughout almost every state.
There is current litigation. The main while it may be separate subject matter, the primary allegation is that the agency is adopting rules that aren't authorized in statute. And so I just think we need to be very, very careful as we look at these sorts of things. And it sounds like, from what you said, it sounds like it's a extremely defensible position.
And I'll say, Mike, that's exactly why this is in the permanent section of the rules, so that there is that opportunity for public comment in case there are some concerns. But we do want to be very careful to not regulate outside of our statutory authority. So your concern is noted.
So this would be like THC-infused beer, not like a tincture that would have a little bit of alcohol in it just because of its nature.
That's exactly right.
Okay.
Any other questions or comments?
That's actually a fair point. Do we need to define alcoholic beverage? Because some products are created utilizing alcohol.
Yeah.
That's a good point.
I think it's fair. If y'all want to do a recommendation to define alcoholic beverage, or just...
I don't know that I want to try to define alcoholic beverage.
I've gone through this process. And that's why I did alcoholic beverage.
Maybe sell any intoxicating or something to that effect. I mean, intoxicating, again, is something you would have to define, but...
I have concerns about that. Just what would the...
What is intoxicating?
Yeah.
Same
what's
as what
the
is
definition of-
alcoholic beverage?
I think alcoholic beverage probably is defined in rules elsewhere and statute elsewhere. Intoxicating has been one of those more tricky definitions.
Then I guess I would just make a recommendation to add a definition of alcoholic beverage to the extent that it exists in other statutes.
Blake, you could also add excluding tincture after those words.
Agreed, but that precludes future products that we are unaware of today.
I'll second Blake's motion.
Could you explain that motion again, please?
Was just to add a definition of alcoholic beverage so that we don't unintentionally capture a tincture that utilizes alcohol in it for a cannabis product. So I believe Cameron had said that they define alcoholic beverage elsewhere in statutes.
I was going to say we might want to use those definitions.
So to clarify, my recommendation is that we define alcoholic beverages and adopt a definition from existing statute.
So we have a motion to define alcoholic beverages as it's defined in existing statute. We have a second from Adam. All those in favor say aye.
Aye.
Those opposed say nay. The ayes have it.
Can we go back up to the authorized contractor? I just want to make sure we clarified the intent. I wasn't around in the last meeting, but if the purpose of this is to not allow someone to use someone else's license, and I guess the issue or clarification I need is on authorized contractor, because I think we see in the industry a lot that people can buy and resell people's products, and they may not. There's really kind of the chain of command or custody has been broken, and do we have a stronger definition of authorized contractor where that person? I get that someone could be 1099 and broker products around there, but should they have some sort of connection to the company that they're doing it for, or rely on anybody to take someone else's product and go resell it to somebody else? Because what I like is that if you are representing somebody else's product, and that license holder should have some obligation to make sure that person that's reselling it has some sort of obligation to make sure that product's right and it stayed in the same forms, it was in the right temperatures it needed to be. And I just don't know if there's a way we can expand on that, or I'm open to hear how the rest of you guys feel on authorized contractor.
Can we get an example of what is meant by use their OMMA license number? It seems pretty broad. So what's the objective?
And just to make sure, you said what, an example on use?
Right. So licensees shall not allow any other entity or person to use their license number. What is meant by that? Use.
For example, I've heard anecdotal reports on individuals approaching, let's say, a grow to say, hey, can I get a transporter card through your license? But there's no real meaningful relationship. I'll pay you $150 or something like that, where there's not really the tie to the license number with the individual that we would like to see.
And then going back to Brian's original point about authorized contractor, I don't think we addressed did we look at definitions? Do we have that in our rules, or are we going to depend on statutory definition for what authorized contractor means?
We do not have it defined in our rules, and so if that's something that you'd like to make a recommendation on there.
Yeah, I think I'd definitely like to make a recommendation on at least a definition of authorized contractor.
I mean, I'm making an assumption that it's in statute, but I don't know that for sure off the top of my head. So.
And I probably need to look a little deeper into this and some, but I think that's where I think the intention here is to, as you spoke earlier, someone uses someone else's transportation license and is running other products around there, and I think that we're trying to clean up that if someone is going to run under someone else's transportation license, then if they're going to sell that person's products, I think there has to be some sort of that they're either hired by that person, they're employed by that person, they have a contract with that person to sell their products, and I think that's where we need to kind of clarify some of these issues.
And I do think we're entering the kind of slippery slope of the current independent contractor versus employee battle that's going on, going on all over the United States. So we probably do need to clarify.
What if we just added something at the end that unless there is a contractual relationship between the parties? Would that capture it?
Can you repeat that?
At the end, comma, unless there is a contractual relationship between the parties. The license, meaning the licensee and the other entity or person.
Would that address?
I think if legal thinks that kind of helps address that and cleans that language up.
Let me ask a question here and see if this even applies. So a processor white labels a product for another brand. Processor would be required to have testing on the finished product, whatever that finished product is. Hands that product over to the recipient, who is going to now repackage that product or maybe package it initially under their own brand. And yet the testing is under the initial manufacturer. That packaging processor would be using the license number for the testing purposes, and would be using the license number of the actual manufacturer. Am I making any sense? I'm probably not explaining this very well. Processor A.
If I may, I'm tracking you, and that does occur. My name is Lee Rhodes. I'm the Laboratories program.
Okay, great. So I'm concerned that this would prohibit that action and would require that packaging processor to actually test the product again, because they would not be able to use the license number of the actual manufacturing processor. Does that make sense?
Yes, I'm following you, and that probably could be the outcome of this. I think in terms of being able to track that transaction, if we had a seed to sale where those test results follow that product throughout its production process all the way to point of sale, that might be more moot of a point.
But it looks to me like that instance, the licensee, the manufacturing licensee, would actually be in violation of that rule for letting the packaging licensee use their license number on the testing that follows that product.
I see it. That's a way to read that.
And
What if we said unless both parties hold an OMMA license?
So I guess what I'm saying is I'm for the intent. It's very valid. I just think there's some instances that maybe we need to think about a little bit further.
And I wanted to ask Mr. Hendershot, can you speak to that, since that's kind of along the lines of what your company does with the packaging and
Yeah, well, we don't white label packaging, but I think we do buy a lot of third-party products, whether it's already oil for the edibles that are going to go in it. But I think from what we've seen, even just when it comes to oil, and I know it's on the finished goods side, is there tends to be a lot of people that come around with multiple people's products, but they're not employed by any of these people. And we've had multiple cases where oil will test hot with pesticides, and then everyone just throws their hands up. It wasn't mine, it was his. And then the person that sold the oil to the broker is saying, that guy's blaming that maybe he switched out my oil. I don't know. And it just causes a lot of problems. And we just want where OMA has authority when stuff like that happens someone has to be held accountable. And so if we're going to allow a broker type of network, which I'm not saying is wrong, I'm just saying there has to be accountability. If you're going to be a broker and represent multiple companies, then you either need to enter into an agreement with those companies that you can do that for, and then we can come back through our chain, because money can get lost. Everyone blames everybody else. And so, I mean, this starts to cover it, but maybe there's another section or somewhere we can add that in, but this is a start to where we can, add some language for, and maybe that's where we fix the authorized contractor or require that there is some sort of agreement in place for, products that are going to be sold by somebody else. But I do understand how that white labeling, just the way this is worded, could be an issue. And I think that was a great point, that maybe if someone's white labeling for someone, both parties are going to have an OMMA license. I think this addresses the issue is just people running around with a transportation license thinking that gives them free will to just run around and sell anybody's product they want, grab it from this guy, grab it from this guy. And we really start to lose where these products are coming from and how many times they've changed hands. And then really, is the integrity of the product still there at that point?
Brian, what if we said except where there is a contractual relationship between the parties, then the remainder? I mean, that would be a good start. I mean, I think this subject will be addressed more in the future, but as far as this is written, I think that could be something that would address it to this point.
Authorized contractor is a very...
I have concern with the use their OMMA license number as well being pretty broad. What is use? Purports to be an owner, or is carrying a product with the license number on it? I mean, two very different things.
Yeah, the two examples that started out with, I mean, to me, they seemed like somebody forging paperwork. And so that would have gone. I mean, people are going to do that, especially with this much money involved. But I would have figured that would have gone a completely. It wouldn't be a tell people don't forge paperwork. It's if you forge paperwork, we're probably going to take action. So, but that's the way I interpreted it.
I'm sorry. If I may add one more scenario, which really kind of prompted discussion of this, it had to do with laboratories. There was a transport company essentially acting as a broker for the laboratory. And they were going out generating business, bringing testing to that laboratory. The certificate of analysis it looked like that transport company was the laboratory. However, all the proper documentation for the laboratory license number and that kind of stuff was on there, but it was in fine print. And I think that's really kind of what prompted this. That transport company was not the laboratory. And that's kind of where the discussion of should that be a situation that we allow it. No, I mean a testing laboratory. I'm sorry. Yes, a testing laboratory. Yes.
Yeah, and I know that's where that stemmed from, but it does, cover a broader area that, I think a lot of people feel, is an issue coming up. So I think we just need to come together and find a way to, at least at this point, just maybe clarify that, because I think we all agree that authorized contractor is a very broad term, and I don't think would change anything that goes on today.
So Blake's motion earlier to add the words, unless a contractual relationship exists between the parties, is that?
I don't think I formally moved for it, but I
Okay.
can. Would that work for you? Basically just adding to the beginning of R, unless there is a contractual relationship between the parties. Licensee shall not allow.
So contractual relationship can be either verbal or written.
We could clarify written.
Meeting of the minds is all contractual relationship.
Written contract between them? I mean, I'm spitballing ideas to address the concern.
I'm not necessarily supporting a written agreement.
Offer plus consideration.
Well, that was my proposal for a way to address this, but I'm all ears if you all have an alternative way to go about it.
Yeah, I mean, there's probably not enough time. I think we can probably fix it in the authorized contractor if we put the right terminology on that to cover the issues, but I can't say we can come up with that here in the next 1 minute.
I'm okay with throwing that in there as a Band-Aid, but clearly legal staff, this is something we're not going to solve in 3 minutes, okay? And perhaps legal staff can look at that and if you would like me to sit in on a meeting, I would love to do that. I don't know if that's appropriate or not, but
So it sounds like the recommendation of the board is for legal staff to go back and revisit the phrasing of section R to ensure that it's tight enough that the words authorized contractor are clear, taken out and clarified as to what we actually mean, and ensure that there's a contractual relationship between the parties if one party is using another's license. So we can do that, right?
We can do that.
Cool. Let's move on. Oh, we need to do.
I had a first from Brian Henderson when we first started, but when it became.
So I think is the motion to have legal staff revisit this language.
Yeah, that's my motion.
Second.
Second. Okay. All those in favor say aye.
Aye.
Opposed? Nay? Nope. Ayes have it.
Before we move on, I do want to discuss T, section T. Can you just kind of give us a little bit of context for the intent behind disallowing growers to be able to transact in cannabis products?
Yeah, so that's where we're headed. So T is the next one. So the prohibition, so by the definitions, growers have the ability to essentially do medical marijuana. They don't have the ability to do medical marijuana products, and medical marijuana products are done by processors, and there's never been ability for processors to transfer back to growers. Now, there's one caveat coming in House Bill 2646 that we can discuss another time. So essentially, this is just clarifying the prohibition that growers are not authorized to make, sell, transfer, or otherwise obtain medical marijuana products alone, except pre-rolls, non-infused pre-rolls, which is coming through House Bill 2646, and then Keef, which has its own ambiguous areas there. So just clarifying that.
I don't have any specific issue with it. I just wanted to make sure that we didn't gloss over it in case anybody who's more familiar with the grow side would have an issue with not being able to, transfer, purchase, or sell MMJ product.
Right, yeah, it's specific to the definition of MMJ product. And I think this is just, correct me if I'm wrong, but I think big picture, isn't this just making sure that growers don't turn into dispensaries, basically, like unauthorized dispensaries?
Yeah, and just making sure that clarifying what has already been placed in definitions and statute and our rules, just clarifying that specific prohibition.
Okay. Thank you.
Was the issue?
No, I just, I can't speak to this directly since I'm not a grower, but I just wanted to make sure that those people who were more tapped into the needs of a grow didn't take issue with the fact that this is prohibiting them from doing anything but flower and pre-rolls. I personally don't know, which is why I raised the issue, but
That's the way it's always been, right? There's even some confusion of whether they could provide pre-rolls.
right. I think that's what this is attempting to address, is that confusion. I just wanted to make sure that we didn't skip over it in case there was issue. I don't personally have any.
All right. So let's move to U. And so U is a prohibition added that states that dispensaries shall not package or alter packaging or labeling of medical marijuana or medical marijuana products except for the following reasons. And just give you, so dispensaries are authorized to package and sell non-infused pre-rolls, which is coming in House Bill 2646. Dispensaries or employees thereof may handle loose or non-packaged medical marijuana to be placed in packaging for retail sale. That, again, is going to be specifically addressed in 2646. And then 30 dispensaries may place medical marijuana or medical marijuana products into a child-resistant exit package at the point of transfer to a patient or caregiver. And that's to address the definition of child-resistant, which specifically applies to having it sealed, opaque, at the point of transfer or sale to a patient or consumer.
This appears to me to preclude barcoding, adding a sticker. Would that not be considered to be altering packaging and labeling? Every dispensary that I'm aware of internally barcodes.
Okay, and that is a good feedback. And so, I mean, especially with this area, if there's anything that you see that needs to be added here or any.
What is the intent in disallowing, not altering packaging or labeling?
So under statute in our rules, essentially you have to have, the processor has the packaging, and so it has to be conforming to the rules, or the dispensary is required to reject it, the packaging requirements. And so the point here is to specifically with the changes that are coming in House Bill 2646, identify those, what dispensaries can do versus what they can't do. And then also just to kind of clarify some things and make it, there's a lot of discussion around these specific areas. So just kind of clarifying that. But it's also one, that's why it's in permanent rules, because we want feedback here and whatever feedback the board has.
What bill was this? What bill was this in?
2646 is the one that addresses non-infused pre-rolled marijuana. It's also one that specifically talks about sample jars, but in that same provision, when it talks about sample jars, it has number 2.
Okay, I guess I'm specifically speaking about, maybe a little behind or ahead, but maybe on you. We got the you.
Yeah, we're talking about you right now.
Shall not package.
So that seems to fall under 2, if I'm listening to you correctly. That seems to fall under number 2, which would be allowed if I'm hearing what you're saying correctly.
Right, okay, so I just wanted to make sure that that was still there, that dispensaries still have that option. I mean, that's what they do. So.
True. We do it prior, like we pre-pack everything, but I know that there, and to clarify, is this intending to permit quote unquote deli style where they weigh it out in front of the patient? It seems to me that that's what that's doing, but my understanding was that that was not allowed.
And this is specifically for flour, correct? Is this not like I can't get a 50-pound bag of gummies and break
Loose
them
or
up?
non-
No,
Okay, good.
correct.
Marijuana, yeah.
So, just
Do you understand what I mean when I say
yeah, no,
deli style?
I'm hearing what you're saying. So, because number 2 needs to be read in line though with that sampling requirements that essentially you can have samples to display in display jars, containers, where people can handle and smell it. But
It was that language that I was under the impression
Right.
prohibited, quote unquote deli style,
Right.
where they're big jars and you weigh it out as you sell it. I was under the impression that that was no longer allowed, but this seems to be saying that it is.
right, so no, I follow with you. Number 2 was in that same statute though, and so essentially, and jump in Taylor if you want to here.
Sure. My understanding of the relevant part of this, and forgive me, I don't have it in front of me, was that the deli style requirement simply pertains to people, a patient or caregiver's ability to touch or smell flour that is being sold deli style, that there would have to be a separate sample jar there. Okay. And the flour that's in that sample jar could not later be resold. But it's like, here's your sample, you can smell it, you can look at it up close. But the rest of the flour from which a bud tender would actually weigh it out and sell is still permissible under law. Did I miss, is that
Right,
your
yeah.
understanding too? Okay,
That's correct.
thank you.
I think we still have the issue of barcoding because this appears to preclude it, which obviously isn't the intent, I don't think. I mean, I don't necessarily have any language to propose, maybe just adding it as, a subpart 4, internal track inventory, or track and trace related purposes, or, again, I don't have the language off the top here, but
No, I'm following
I don't
you.
think that is intended to be precluded, and this does.
Okay, no, that it's not, and so.
So my recommendation then would be to add an additional subpart 4 that permits license holders and or dispensaries to, apply packaging or labeling for internal or state seed to sale tracking purposes, to the extent that it doesn't, violate the others.
The one other piece to that I would add is that any barcoding or sticker added would need to not cover pertinent information for the
That's exactly what I meant by to the extent that it does not obscure the other statutory requirement.
And I'll make a motion to. Did you make the motion? I'll second it.
Okay, this is a fun one. I was trying to track as you were saying it, but basically the motion is to add a number 4 to add language regarding dispensaries' ability to apply. Hold on, let me go back to the language. So to add an exception so that they may apply for track and trace purposes such as barcode. I'm sorry?
Or internal inventory.
Okay. We can work out the language, but the basic intent of what you're saying is dispensaries can apply for track and trace purposes or internal inventory items such as barcodes to the extent that it remains within statutory requirements, which fall into what Adam.
Correct.
Okay.
So long as applying that label doesn't, obscure the net weight, for example.
Okay, or appropriate warnings. So we have a motion, a second. Is everybody tracking enough to be able to vote on this? Okay. All those in favor, say aye.
Aye.
Opposed, say nay. Okay, the ayes have it, and we will work on that language.
Thank you.
So I would like to address number 3 now. So, and I may be showing my ignorance here, but I really don't like the word may. And I'm assuming that may is there because most of the time it's a packager that is putting the products in a child-resistant package. The reason I don't like number 3 is if we are doing things quote-unquote deli style, I think that dispensaries must place medical marijuana into a child-resistant packaging.
I believe that is in the statute.
Okay.
Yeah.
As long as it is
and
somewhere.
most dispensaries aren't doing this anymore because they are required to reject non-compliant packaging, and non-compliant would be not child-resistant.
Okay. I will say most all packaging that I have seen personally is. I just wanted to make sure that there wasn't a way for dispensaries to try to get around that. So is that addressed somewhere else, I assume, in the statutes?
Yeah, so
Okay.
all packaging at the point of sale to the consumer must be in child-resistant packaging.
Okay.
When it says exit packaging, is that talking about you buy a few different products at the store, they put it into a sack, and then they fold it over? Is that what we're talking about, the exit
Yes.
packaging?
Yes.
So it's already child-resistant, tampering-proof inside the individual package that's inside the brown bag that they give to you when you leave the dispensary, right?
Correct.
Okay.
To your point, we as a dispensary would have to reject that product if it were not in child-resistant packaging.
Okay.
Per statute. I think this is just permitting an extra fail-safe.
Gotcha.
Oh,
Yeah,
sorry.
so specifically, though, I do want to point to your comment, though, that it does say into a child-resistant exit package. And so that exit package itself will be the child-resistant part.
It would be
So
an
not
additional
just a bag
fail-safe.
that you roll up, but yeah.
Michael's question, correct me, is everything inside that package, whether it's child-resistant or not, inside of its own child-resistant packaging? Which, yes, it should be, because we as a dispensary would be required to reject it if it were not.
That's where I was hoping to get some clarification, just because I believe that the child resistant, which in our definition of child resistant, that's where the opaque and resealable requirements come from.
With the exception of single use, I believe, yes.
Yes, thank you. I believe that is at the time of sale to a customer, meaning patient or caregiver, not a commercial transfer.
my knowledge, we as a dispensary must reject non-compliant packaging. And unless it were a single-use product, it would, by definition, have to be child-resistant, to my knowledge. Could be wrong.
But I believe that the compliance of child resistant comes in at the time of the transfer sale to the patient or caregiver.
I believe the language is...
And I don't have it in front of me. I just want to make sure we're all getting the best information possible.
Let's confirm that, but I do believe it's we can't transact in or out unless it meets the packing label requirements.
I guess my assumption was there would be no need for that section at all if all of them were required to be in packaging. There would be nothing that would prohibit them from putting things in a child-proof package should they want to. Am I making sense? But it looks to me like the only reason that's in the rules is to say there could be some products that are not in child-resistant packaging already, and then those things may be put in a child-resistant exit package to satisfy the child-resistant portion of the statute. Am I making sense?
It's actually just at the top of subchapter 7. If you scroll down the hair, there's the prohibition.
And I think to your point, 7.1a, just to confirm that we're all on the same page here. Yes, however, packaged and labeled in accordance with the Medical Marijuana Patient Protection Act in statute. Thank you. So under that act in statute, by definition, child resistant only is required at the time of sale to a patient or caregiver. We're pulling it up here.
Right.
And I think the point we're getting to is what an exit package is, correct? And so it's the package that goes into the hands of a patient or caregiver.
I don't believe it's defined right now, but yeah.
Okay.
Or to me, this whole section basically deals with flour, and it's whenever you go into the dispensary, you pick this, and they have to put it in the container that seals closed. And then if some places will put it in a paper bag, so you wrap it up and leave. Some places wouldn't, but it's still in that child-proof container at that point. And if it's a food item, it would have been in a child-proof or some sort of container from the manufacturer before it even got to the dispensary. So I would think, or this whole section is literally only dealing with flour. Is that correct?
Essentially, yeah. Or just going back to the bigger point as well, that if somebody's getting a processed product that's completely 100% packaged, just making it clear that a dispensary can't open that package and then, sell one of those 10 servings kind of and undo the conforming packaging and labeling once they've received it.
More appropriate then is just to prohibit a dispensary from okay. Keep moving. Let me think on this a second.
And I believe they pulled up, it's 3, Mr. Cantrell.
I mean, the way I interpret 310, 681, 71A, that very first thing that we just looked at is that any licensee cannot sell, distribute, or transfer, purchase, being a form of transfer, medical marijuana or medical marijuana products that are not packaged and labeled in accordance with the Act or these rules. I interpret that as a dispensary owner to mean that I must reject or not purchase non-compliant, aka non-child resistant packaging. Is that an incorrect interpretation?
So let's just say this for now. We'll continue to legally evaluate that, but because
I think your interpretation is valid, and we just need to discuss to figure out how we've been interpreting and make sure it's meshing altogether with the law. thank you for sharing that because that's incredibly helpful.
Right. I mean, I don't think it necessarily could pertain just to flour. It could be many other products as well, where the dispensary buys the product in bulk, in a jar, in a bag, in a whatever, and then they cut that into smaller sections to be packaged and resold. And
But
it
they would
looks
be
to
a
me like
processor at
this.
that point.
This replaces where it says all products sold in a dispensary have to be in childproof packaging. That it says if it's not already in childproof packaging, you can use the exit bag as meeting the requirement for the childproof packaging. And I think that's something that, Ms. Edelin, I hope I'm getting your name correct
No, you're
here.
fine.
I think that's something she had taken issue with earlier, if I remember.
Okay, well, my thought was that if I got like a concentrate or anything, and then I'm breaking it into smaller portions, that's a processor, correct? That's a different type of licensure.
No, they're not changing the constitution of the product. It's just like taking a pound of flour and making 16 ounces out of it.
Okay, well,
If you take a pound of product and make 450 grams out of it, it's the same thing. You're not changing that product at all. You're just dividing it into smaller units. So if you do that, then they're saying that does not have to be in a child-proof package or child-resistant package, that they could put those products into an exit bag that is child-resistant, and that would suffice to meet the statute and the rules. That is what I believe that language says.
That was my understanding of it as well. I think the conversation was prompted by Christie's desire to have may language changed to be
So
mandate.
must
Is that correct?
ensure or something like that along those lines. I don't like may because it seems to give them the option, even though above it does clearly state that it needs to be in child-resistant packaging. I think that this just needs to substantiate that in a stronger language.
I think the confusion there is that generally when it gets to a dispensary, it's already in the necessary childproof packaging. So that's where the may came in, because otherwise it.
This was allowing an additional opportunity for an additional safeguard, was my understanding.
So could we not change it to must ensure? That way, if it did come to the dispensary in that way, it's already child resistant, then they're covered. But I feel like the language of may, it kind of gives them the option. Whereas if we were to say must ensure, then by some method, whether it came to them child resistant, whether they're putting it in a child resistant, it's got to leave their facility in a child resistant container. Does that make sense?
And you're already required to do that, correct, Blake?
Again, that's my interpretation of 7.1a.
Okay, so we'll make sure that that's clear in law.
okay, the one thing that I would ask is it in 2, that be, or the 2 up there, it be pointed out that is not edibles, because that would open up a whole other level of chaos in dispensaries. Because that would get, literally back to this.
I think within the statute, when they say medical marijuana, it's by definition flower, medical marijuana product, everything else.
Okay, well, it doesn't read really smooth. There was my concern, though.
Yeah, throughout the entire rules of the statute, anytime we say number 1, it's specifically defined, as to include flower. But if it's any product, it's going to say product.
It may be in here already, but would that also include pre-rolls? I know that's kind of what we're dancing around. Is medical marijuana, when it's using the statute, intended to include pre-rolls or other flower-based products? Is that?
So historically, pre-rolls have been considered a medical marijuana product. And so anytime that we've added pre-rolls, we've tried to specifically clarify that in here to include it, since now we have House Bill 2646 coming into effect that's allowing dispensaries and growers to do that. And so That's why we did number one, a offset of itself.
Chrissy, do we have a recommendation?
I would still like to see just the change there. I don't know if everyone else is in support of that, but I just don't like the word may. I feel like it gives them an out of, if they are dispensing, like you had mentioned, deli style, it seems to give them the option of whether they, and I see the point of most of the time it's coming into their facility in child resistant packaging, but again, if they are doing the quote unquote deli style, I feel like that leaves some interpretation there, personally.
Would it be appropriate if we made a recommendation that says that in their review of the statute, specifically the 718, where it's a prohibition on a dispensary accepting non-compliant, non-child resistant packaging, in their analysis of that to make changes to 3 as needed? Does that make sense? I think you guys were going to read 718 in context with this to see if we needed additional language. Is that correct? Okay. So would a recommendation that when they're doing that to make adjustments to 3, if they determine that it's not captured, be appropriate? Okay. Would you like me to make it, or do you want to? Okay.
I'll make a motion to essentially evaluate 71A and this, what is it, U3, to make sure that all products being dispensed by dispensaries are going out in child-resistant packaging.
I'll second that.
All right, so we have a motion for us to evaluate, our legal team to evaluate that all products being dispensed are going out in child-resistant packaging. And we have a second. All those in favor say aye.
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 Those opposed say nay. The ayes have it, so we can move on.
All right, the next change that we have is requiring that medical marijuana dispensaries to post a sign or decal clearly identifying that the licensed premise is a medical marijuana dispensary and the license number of the dispensary.
Is there going to be a form template for this, or sure, but what does that look like? Like, are there size requirements? Can we just slap a label on the door? What's the intent here?
So, I mean, the intent is to make sure that when patrons are walking in or before they walk in, that they see it as a dispensary, because there's a couple dispensaries out there that apparently have not clearly identified, so people think they're walking to a bakery or some other business. And
what is like a liquor?
and we get those complaints. So
You may not know this, Mr. Capps, off the top of your head, but does liquor stores have some kind of requirement when you walk in there? I mean, I think they do. It says you have to be 21 or older, probably, but something similar to that is kind of is that what you're going at?
essentially, yes. And so the only specific requirement we have right now, we don't have a size requirement, but if that's something that y'all would like to recommend, then we'd be willing to listen to that. But the only specific wording that we have required under there is medical marijuana dispensary and then the license number. So
I have a quick question. Is there anything in the law that prohibits cities from doing this on their own, requiring signage based upon local zoning laws?
you're going to have to ask the cities.
Is there anything, though, within the state statute that prevents a city from doing it?
To me, I wouldn't know that.
Okay.
I'm not sure. I know cities' power to regulate medical marijuana businesses has been limited, but I'm not sure about this specific piece.
Right. Within 310-681, there's nothing that says a city cannot enact.
No.
Okay. Thank you.
Cities can, as long as they don't discriminate and treat them differently from other similar businesses, they can regulate those types of businesses any way they choose.
So my recommendation, and we can have additional discussion before it gets seconded or anything, would be to strike this under the grounds that individual localities can make their decision based upon local zoning laws.
Any discussion on that motion?
While, I like the idea of local government, local control, I do have concerns about certain small towns and city councils, for example, that may be anti-marijuana and either do it to extreme, requirement, or some that are the opposite and don't want to do anything at all, and then there's no signage at all. So that's the only concern I'd have is just the uniformity. If you have somebody across the street who's in one town versus the other town, you could have some issues there, but that's the only thing I'd point out.
I'm fine with striking it. I'm frankly indifferent to it. My only recommendation, should it stay, is that similar to the way that y'all have a, guidelines about the THC symbol, for example, that you just prescribe a form, minimum size, maximum size, just some context for that. Because as it reads, that could be anything from the entire frontage to tiny little one down in the corner like the alarm permit. So
I think that was a bit of the intent, just to not add anything overly burdensome for some of the smaller mom and pop shops. They could write it out and put it on their door, and that would satisfy this requirement.
Something in writing to that effect is all I'm recommending.
I'd recommend, if it's possible, to have a template that could the owners could just print off, and they know it's in compliance, and all they do is grab some Scotch tape and tape it up there if they wanted.
All right, thank you. We will take those recommendations. Do we need a motion for
I would actually motion to add a template. Going to say 18 point Times New Roman. 18 point Times New Roman. To have a template lined out in this language.
So actually in the rule language as opposed to like a guide lining out how to do this?
Yes.
Well, let me ask you this: is the THC symbol guide, statute, quote unquote? Is it enforceable? I guess I should say.
labeling and packaging guide?
The little THC symbol, 0.6 by 0.5, I believe it is, with hex codes for the colors, all that.
I do think that's in statute, but Taylor, can you?
I know in rule, I believe it says as prescribed by the authority.
Why don't we just do that then? As prescribed by the authority.
I think that works.
Okay, so your motion is for us to create a template and add language saying that the sign must be as prescribed by the OMMA.
Yes.
The signage.
Just point of clarification, is it a required use of that template, or is that an optional template that they can use?
That's up to you guys.
I'm fine with optional, because somebody might, Mr. Cantrell might have a better idea of how to design it for his dispensary or make it.
I think maybe just minimum requirements must include, as you've already said, name and license number, must be at, legible at minimum this size. I think just minimum should be fine, and we'll take it over the top.
But the bad thing about that is if we have it as a suggested, but everybody gets to do what they want, then we're right back to where we started as to how you advertise. These aren't products that people just don't know where they're at. If somebody's put in the effort to get a card, they know where the dispensary is, and if they don't, they could probably walk toward it blindfolded just from the aroma. The fact that they don't post what it is poor business sense. I mean, to me, that tells me that you don't want people coming into your business. So I really think this is kind of a thing that would be handy, but to make it a requirement, I'd be hesitant on it.
And I think the issue is a little bit the opposite of what you're saying. People who don't know they're walking into a dispensary.
Yes, but they should because you can usually tell 2 or 3 doors down that you're walking near one. That's what I'm saying.
With the great big green signs and the cross and the things blowing up and down, and they don't know they're walking into a dispensary, car flags and. Okay, so I guess if the big 30-foot sign out front and the great big green cross flag out front is not enough of a sign that this is what this is, I'm not sure how putting something like this on the door is going to help. But if we want to, perhaps we just post their license on the door. If you want to do something that way, I mean, why go to another template? We already have one. Just have them frame it or tape it or put the license on the door or the front window. I'm not sure if they didn't see the big green flags and the thing blowing up and down like that, they're probably not going to notice the license thing either, but just saying.
As just a point of information, this is something that our compliance inbox and our complaint form, we not infrequently get complaints about people who walked into a dispensary that did not recognize it as such. It's usually, I'm familiar with the examples that you've given, but I think that there are some where it's perhaps less obvious.
Can we just say they put their license, have to post their license on the window? Would that be too much of an imposition to dispensaries? Would they take offense to that?
Like I said, I'm different on this one. If we need to put that on the door, sure, but I don't know that it necessarily is going to accomplish the intended goal of identifying a dispensary to someone who's, got tunnel vision.
So my main thing is to make sure that all these rules are easily readable and consistent and necessary. So that was why originally, is this necessary unless your town, has some sort of zoning, whatever. And, I understand people who walk into dispensaries unwittingly, but is it something that we're willing to enforce to an extreme necessarily? Or, if it is, it needs to be consistent throughout, and that's why it would need to be a template or, like you said, a license posted. But what is that going to necessarily do? So I just want to make sure that the rules are consistent and concise and have very specific meanings so that they cannot be misinterpreted.
Did you have a recommendation?
I'd probably go back to my move to just strike it. Yeah.
Okay, and I would like to
I would move
second
to
that.
strike the signage requirement.
So move to strike the highlighted language 310-681-6-3.
And I'll
Seconded.
second.
All those in favor of striking this language, say aye.
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 Opposed, say nay.
Nay.
We have one opposed, but the ayes have it. Correct? Oh, two nays. Okay.
I guess my concern is the same as what I'm hearing from OMMA staff. Are there places out there, granted, I know you should be able to smell it, but you have someone that's naive, doesn't realize, is there someone that's touting themselves as a bakery and you walk in expecting to get, regular cupcakes and cakes and cookies, and lo and behold, it's marijuana. I just don't know what's out there. And so that's why I'm hesitant to say they don't have to put anywhere on their storefront that it's a medical marijuana facility. Does that make sense? So if there are those facilities out there, granted it's poor advertising, I agree. I just don't know what's out there. So are there people out there that are saying, hey, come to our bakery, and then you walk in and it's like, oh, whoa, this is not the type of bakery I was expecting?
So I think, number one, a bakery by definition would be a processor which could not sell to a patient directly. Just in your example. I hear what you're saying. I just don't know that adding a little bit of text on the door is going to do it to somebody who's not noticing what's right in front of them.
Sure.
Another thing, too, the reason why I voted nay on it is because you could also have folks that come to visit Oklahoma who are from out of state, and then they don't know, maybe they're walking down the strip mall and they don't see the sign up at the front of the street, and they open the door and they realize, they walk in and, they don't have a patient card. They don't know that they're not allowed to be, I don't think you're supposed to be in there even if you don't have a license.
You just can't purchase THC.
But similar to, that's why I brought up the question about liquor stores and whether they have something on there that says, this is a liquor store, 21 or older. Actually, that's not the law anymore. You can be any age as long as you're with 21, I believe. But it says you have to be 21 or older to buy. I could, and I know the sign language right now doesn't say that you have to have a patient license to come in or buy, but that's something I would think if we do signage to have that on there so that people know you have to have a license. We aren't a rec state as of yet.
Would me explaining how it happens in practice be of benefit, at least in our case? Essentially, whenever a patient comes in, their first stop is to check in. At that point, we identify whether they have a patient card or not. We scan it into our system for record keeping. If they are not a patient, we notate that on our point of sale system so that they cannot, they're locked out of cannabis products. So, if the person walks in unaware of what they're walking into, at least in our case, they're going to find out pretty quickly. Simply by walking in, period, and looking around, or by, coming to the check-in point. I can't speak for what other dispensaries do, but that's how our process works.
Can you buy, this is my ignorance, can you buy from a dispensary, like say you go in there and you buy the raw papers, right, that don't have marijuana in them, but can you go in there and buy them without a license?
Yeah.
Okay. So there are some reasons for someone to come in that doesn't have a license.
And you can also purchase CBD-only products. You can purchase, we have a location in Bricktown that gets a lot of out-of-state people just coming in out of curiosity. They buy T-shirts, that kind of thing. The prohibition is on THC-containing medical marijuana products. So,
And I suppose, and I just realized that I've done this before. I've walked down the strip mall, talking on the cell phone, thought I was at the right store, turned in, realized as I stepped in, oh, this is the wrong store. I have to go one more door down. I wasn't injured. I didn't get hurt. There was no offense or affront, or I don't know what problem we're solving here. This seems to be a solution without a problem.
So it sounds like the motion to strike carried, and we will strike that. And if we propose anything like this in the future, we'll come prepared with examples of other analogous industries that have signage on their door and what that looks like. Let's move on. Just for the record, we do have to finish this number before we can do lunch.
It says lunch may occur between the middle of any agenda.
Before what? Okay, so let's just take a vote. Who wants to have lunch? Raise your hand.
How much is left? How much time are we looking at here? Because if we only got a little bit left, I'd say we
that's
just
a good
keep
question
going.
because the signage one took a little bit of time.
That's exactly why I'm asking. I mean, if we're on page 80 of 130, do you know how many changes we have left?
There's more permanent probably in lab than anywhere else.
The lab
And
part.
so we're getting into the lab part here soon.
But if everyone can wait and we push through,
I prefer we just power through it. If there's not much left, as opposed to take an hour break and then come back for an hour.
okay, Blake is making a motion to push through
Indeed,
and
I
not
am.
pause for lunch. Do we have a second?
I
I'll
second
second.
it. There's no issues, I imagine, with open meetings since we put a time slot on that and all that, I imagine.
Yeah, I'm hoping.
So it's all or nothing.
I'm sorry?
If we do take a break, we have to reconvene at 1 p.m. to follow the agenda. So it's all or nothing. We can't decide to break for an hour.
We can't. I thought that's what that said. It may occur during the middle of any agenda item.
It can, but the timing is the purpose for that.
Bureaucracy is real, guys. So if we take a break now, we have to be back by 1. If we don't take a break now, but we choose to take one later, we still have to be back by 1 because that's what's on our open meetings agenda. So with that in mind, would you like to break for lunch now?
What we got to do back there by 1, we have to.
So we're just staying here to rush through till 1, we'll be here at 1. So
Agreed. It's just Nina was making sure to point out that because the agenda, the open meetings agenda says from 12 to 1 p.m., if we can't just take an arbitrary break later for an hour, we have, no matter when we take a break, we have to be back by 1. But your point is exactly right. We may be done by 1 if we push through.
Or if we push through and we hit a roadblock, we could be stuck here to 4:30 with no lunch, with everybody's blood sugar getting low and everybody getting angry.
Yes, I think that's why Nina wanted to make sure everyone understood that. So,
I also don't want to put the staff out, obviously, if somebody, y'all are sitting up here and have to be part of this meeting. If y'all need a break, I think I could probably speak for the others that we'd be okay with that. I'm fine with powering through, but we'll get Cameron a Snickers.
and the rules around us eating lunch, we have to all eat separately. We can't talk about any of this. Is that correct? Okay. Can't have quorum. So cannot go to lunch together. Actually, that's the rule, right?
What? Let's just take a vote here.
I don't care what we do, but you guys let us know.
Make a motion to substitute our hour-long lunch break with a 10-minute restroom break and then continue.
All right.
Second that.
Second. Ayes?
Aye.
Nays? Okay, ayes have it. Let's take a 10-minute break. Okay, it's been 10 minutes, and in the interest of moving forward like we were suggesting, let's go ahead and move forward. We will check for quorum first. We're missing Norma. 7. So we're missing Norma, but we have a quorum without her. What's the procedure? Since we have a quorum, let's move forward.
Adam Austin,
Present.
Blake Cantrell, Christy Edelin,
Here.
Mike Irvin, Brian Hendershot,
Present.
Philip Drina,
Present.
Michael Leake.
Present.
I'll count Norma absent until she comes in.
Excuse me.
And we do have quorum.
Thank you, Cassie. We are going to pick up on page 82 of the permanent rules. There's Norma. We are going to pick up on page 82 of the permanent rules, correct?
That's correct.
Oh, is it
Sorry, page 80.
page 80? I skipped that one. Okay, so we are page 80. I'll turn it over to Cameron.
Okay. So the next change that we have here essentially is a requirement being added for packaging and labeling that packages and labels shall be considered inaccurate if the percentage of cannabinoid and or total THC claimed to be present on a label is plus or minus 15% of the percentage on the COA. And so we added a specific example. So if you have that 100 milligram bulk packaging on your package, that if the COA is plus or minus 15% of that, that packaging would be considered inaccurate. And so I'll leave that up for discussion or if there's any questions there.
Out of curiosity, where did the 15% come from?
15% is a pretty commonly used throughout different states across the country. And so it's kind of just keeping in line with that variability number.
Mike, do you believe that's reasonable, with you being the processor at the table?
Yeah, I think we've seen
Okay. The way that I've seen this come into play is specifically with edibles, where we have purchased from an edible manufacturer, what their packaging labels as 100 milligrams, and it's in fact 110, But can that be corrected? Because packages and labels are two different things. So could, for example, if we had printed on packaging, it says 100 milligrams just on the design of the packaging itself, could we, potentially, I guess, fix it? I'm blanking on the word. Remediate, I guess you could say, the label by applying a label on top. Because essentially, in our example, when we white label a edible, for example, we send it to a processor who conducts it. We've already ordered packaging for that edible that says 100 milligrams. But if they were to come back and have 116 milligrams instead, does that mean that we have to reject what we've already paid for, or can we remediate it, so to speak?
It's attempting to address the variability on packaging for patients to let them know what they're actually getting. So if it says 100 milligrams and it's 70 milligrams worth of THC, it's trying to ensure that they have the appropriate doses while adding variability into the knowledge that there is differences with labs and there's going to be some variability within the processing.
Typically, that's going to come with
Okay, sorry, we have to pause due to Open Meetings Act. Since we put 12 to 1 on our agenda, we are not allowed to convene until 1. Sorry about that.
So it means we return at 1 and we can reconvene and apologize for that inconvenience.
Motion to convene then? Do we have to? Well, we're getting pretty formal here, so.
Okay, it's about 1 o'clock, and it looks like looks like we have quorum. And Cassie is going to confirm that we have quorum.
Adam Austin,
Present.
Blake Cantrell, Christy Edelin,
Here.
Mike Irvin, Brian Hendershot,
Present.
Philip Drina,
Present.
Michael Leake.
Present.
We have quorum. Norma Sapp, I'm sorry. I'm so sorry. No.
Okay, before our lunch break, we were discussing on page 80, number 13, and we left off with Mike Irvin giving us some commentary and thoughts on it. I'm sorry I had to interrupt you. We received information about the Open Meetings Act that we needed to make sure to follow immediately. So let's just pick right up where we were. I believe so, and I'm going to ask Lee Rhodes. He's our director of our labs at the OMMA, and just a quick reminder, housekeeping-wise, after lunch, if you are going to speak, make sure you turn your mic on so that the people listening at home can hear us. Okay, just make sure. I couldn't see if yours was on or not, but it'll help with the open meetings part too.
It has more to do with the fact that we get an awful lot of questions from somebody who will say, my packaging says X. I looked at the COA and it wasn't the same thing. And then that raises questions in their mind. We'll look at those values and they'll be well within a certain window, certainly plus or minus 15%. So I think it had more to do with helping people understand that nothing is going to measure exactly 100 milligrams in this case. It may be off a little bit one way or the other, so that they understand when they're purchasing it that they're still getting basically the dose that they're expecting to get.
Okay, so this is probably different than I thought it was then. If the label is different than the COA, then either through accident or intention, numbers on the label. Because COA is clear. So I don't know how from that explanation, it seems to me like if I falsify a label up to 15%, it's okay. But if I falsify a label more than 15%, then it's not okay. And to me, the label should reflect the COA, regardless. One is too much. Now, I get it if they actually tested that one product, that one piece of chocolate. And that one piece of chocolate was 14% different than what the COA and the label said. That's within, but if it's 16, it's out of compliance. And those folks need to do a better job of making sure that their infusion is done, their processes are done better.
And Lee, does this come down to the difference between packaging and labeling that Blake was talking about earlier? Because there's the bulk packaging that will say...
Yes, that's where it comes from, where people will buy a gross of packages that will already have on it 100 milligram X is in this package, and the testing won't be that.
The place this comes up, and I've seen this on a number of occasions, is, well, specifically for clarity, packaging being the actual container that contains, in the edibles case, say gummies, versus the label, which lists the actual COA, total cannabinoids percentage, as well as the THC. So we printed up, say, a bunch of labels for 100 milligram edibles, but when we actually have them processed and get them back, they're more like 120, say. So instead of 10 milligrams per unit, they're 12. I think that's the use case of that this is trying to address. I think the largest discrepancy we have seen, and I just kicked this to my team on Slack real quick, is 65 milligrams that should have been 50. Is the largest discrepancy. Hope that helps clarify.
So am I the only one here that thinks that 15 is a huge number? I mean, I come from a compounding pharmacy background, and I can't imagine if a provider told me to compound something at 100 milligrams, and I sent it out the door with the patient, and it had anywhere from 85 to 115, that the State Board of Pharmacy would be very thrilled with that. I just feel like that margin should be smaller.
And I can't speak to it directly as to the reason, but to my knowledge, the reason that there is a discrepancy is in part the raw material being utilized, the distillate being utilized to make the edibles, as well as there's like roughly 10-15% attributed to spillage, burn off, that sort of thing. That's why it's inexact, is because we can't know the exact dosage until the final product is reached. Not to say that that can't be done. I don't know. I'm sure it could be better, but it's not uncommon for us to see that. A marginal discrepancy between the package label, or the package, what's printed on it, 100 milligrams, 10 milligrams each, versus what actually comes back. So I think this is intended to put a framework on the high and low end of that, so that, worst case scenario, we're 15% off. And I think that's reasonable, just because it's a function of how processing works with edibles, to my knowledge.
So who is testing this to see if the discrepancy is higher or lower? Or are we just like random samples from the field?
No, every product has to be tested. At this time, we're not really going out to see does the COA match the packaging labeling. We would be incumbent upon us to start looking at that with this rule.
Okay, that's where I was getting at. Was there going to be like a quality assurance type program or something kind of running along to make sure that this gummy or that type of thing is all within range.
I think we would need to do that, add that to our checklist. Taylor's not here right now. She probably have more specific information on that, but it would be something like that.
Right. It would be a compliance thing with our inspectors going out there, and they have, every business is required to keep their COAs, and so when they're looking at the packaging, they would be able to compare that. So it'd be a...
So this goes back to my original point, which was, is there an avenue to remediate, so to speak?
And I know that Mr. Hendershot had something to add.
Well, no, I mean, I think, we produce over 500 SKUs, and I think 15%, coming to your point, from compound pharmacy, that makes sense. I mean, this industry is in its infancy, and I think until labs have a set standard that everyone can follow, that you got to have some error because they can have up to 10% error on their end. Secondly, I think for the bigger processors out there, I mean, when you're running a batch run, you're going to run just a small amount with your formulas and take those and then you run to get your test and get those back. And if that's the case, then you run the rest of your run. I think where people, this comes in, this is helpful because it's if people want to just speed up the system and not worry about quality and dosage, they'll just run their whole run. So if it comes down, if it's different, then they just stick their batch sticker on the back of it that says it's a different dose. And right now that's okay. And I think 15% is probably a good, fair place to start. And as far as remediation, I mean, not really on a final product. If you've already ran a full run of something and you waited till the last minute to check your dosage on there and it's not right, you're going to throw those away because there's no way to remediate. You're not going to remelt down more than likely.
To be clear, by remediate, I meant not the product itself, but maybe applying a label on top of the dosage that was incorrectly printed on the packaging.
Yeah. But I do understand, I mean, a lot of our packaging is already pre-packaged for the dose requirement on there. And so, but what I would say is we've all seen the labs get quite a bit better. And we really, I think if a lot of people happen to test their oil at the same place that they're going to take their final product, that it's really been improved a lot lately. So.
And so just kind of go back to your point as well. So obviously it would come, if it's inaccurate packaging labeling, it would fall under the prohibitions under 7-1, the non-acceptance or return. But as far as putting new labels and packages, I know we have a couple of different provisions that would apply there, such as 7-1, D11, where labels shall not be designed and applied in a manner that does not cause patient confusion. In the event that any package or immediate container of medical marijuana or medical marijuana product is relabeled, all prior labels must be removed in its entirety. There would be a couple of different provisions, and that's going to be like a full legal analysis. But this is just addressing the issue of the variability and that it would potentially fall in as an inaccurate label.
So where this could become problematic, in the example of a white label, where easiest example would be we purchase distillate, send it to a processor for them to make edibles, which, in many cases, we either pre-purchase the packaging or we pre-purchase the distillate. They send it and then they split the yield, right? We're not really in a very good position to be able to tell that processor when we're already out the money, hey, we can't take these because they're outside of the 15% discrepancy. Ideally, we would be able to fix the packages, remediate the packages, whatever verbiage, to reflect the actual dosage in that event. Is that workable?
Again, I would have to do a little bit of a legal analysis, but also if you want to recommend some language there to try to add something, that's also an avenue here.
So Blake, to clarify, are you saying those packages that come back outside of that 15%, let's say it's labeled 100, but it comes back as 65, you're saying to remediate the package to where you put a label on it that says 65 instead, not addressing the 85 to 115?
Correct. In those cases where we're not really in a position to reject, specifically white label. That's a pretty common thing in the industry, and Go ahead.
I said, can you explain what white label means?
That was exactly what I just lined out, where easiest example is we are wanting to do some Peak branded gummies, right? Well, we're a dispensary. So what we, theoretically could do is, contribute towards or purchase or put money up front for a processor to acquire distillate and to create the end product. We prepay some portion of that, whatever's agreed upon. In that event, now we've got a lot of money in packages for 100 milligram packaging. If the processor who's already got our money in their pocket comes back with one that's 116 milligrams, we're in a tight spot because we are already out the money and it's off by a milligram, and theoretically we're supposed to reject it, but we've already paid for it. So is there any way where in that circumstance we could correct the packaging? Again, going back to the difference between a label and a package, the package being the container, the label being what you slap on the outside with the actual COA percentages. So the information is there. It's just conflicting. But this is pretty standard for most edibles. Very rarely are they on the money.
Couldn't you just sticker, if the issue would be you have a 100 milligram package, couldn't you just design a nice sticker that you want a 85 milligram package?
That's what I'm suggesting. Is
yeah,
because we're already out that
I think
money.
it allows you to do that, right? That's not stopping you from.
Well, no, it doesn't, because again, packages and labels are two different things. The label is going to be right, but the package won't, because the package says 100. It's actually.
But you can still put a
116.
sticker over. You could design a sticker to go over the 100 milligrams and put 85 if you wanted to. I'm not saying
This is what I'm proposing, but the way it's currently drafted, it would not permit that.
Because he's saying the package would be incorrect under the label. The package would still be printed with 100 on it.
But I'm saying you could. But your package could have
technicality.
something over that, right?
Yeah.
The
But I
way
get what
that
you're saying,
the way that the language is drafted at present would not allow for that. But I'm in 100% agreement. That's what I'm proposing that we allow for. The ability to go in and alter the packaging to reflect the actual COAs in the event that they are outside of this range.
So what does that look like? I mean, we can take that and continue the analysis and rephrase it, because basically it's just as if we are looking at it using strict construction, yes, what you're saying would be problematic, so we need to make sure to clarify. But if you're comfortable with us working on that a bit behind the scenes and analyzing it, we can do that.
So would maybe the recommendation be that there be some provision for an exception to this section 13 that would enable packaging to be altered or stickered over in order to get it compliant? Would that be the direction?
Right, we would take that as the recommendation and then figure out how to make that work with this language, to be clear.
I'm hesitant to try to spitball something in terms of language without reading it in context with the other pack and label requirements, but I guess then I'd like to make a recommendation that this section 13 be analyzed and a exception for packaging remediation be allocated for.
Second.
We have a motion and a second.
I wanted to comment on that because we have three different things referred to in this section. We have packages, we have labels, and we have a COA. Packages and labels shall be inaccurate if the label and the COA do not maintain or remain within 15%. There's some grammatic things that have to be changed here, I think, because what we're saying is the package and the COA are differing in these And that's why I was confused on my initial comments, because the statement says if the label and the COA are different, which has nothing to do with the package whatsoever.
Mm-hmm. That's a good point. You're right. The way it's written,
So
it'll never be an issue because the label will always be the
the
percentage
label
of the
will
COA.
always,
Right.
unless there is some fraud or some attempt or some mistake,
Yeah.
the label will always match the COA.
I think that those
So that
terms
would
got
never
conflated.
happen. So I think we have some things to address here that may be a little more than this committee wants to try to address at this point.
And I'll be honest, I had that marked before this meeting. So that word label, because it is supposed to be how it reads, package and label. And so that will definitely be cleared up a little bit, but also just whatever.
What was my recommendation sufficient enough to capture what Mike added?
I believe so.
So I know we had a motion to
Just clarify the intent or meaning of Section 13 and provide for a remediation of the packaging when possible.
We had a motion on that from Blake and a second from Adam. A second from Michael, excuse me. All right.
Well, the thing is also the package is just the bag. It is just a container. So unless that has some sort of stamp, like stamped into the plastic that says 100 milligrams across it, it's just a container. And then the label.
They do. I think that's the issue. That's what we're talking about. Yeah.
Okay. I've never seen one like that. Okay. That answers that.
Okay, so we have a motion and a second on Blake's recommendation, and we need to vote on that. So all those in favor, please say aye.
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 Those opposed, say nay. Okay, the ayes. We'll move down to the COA part.
Okay, so the next added thing in the permanent rules, though, is just clarifying that THC potency on the label is that is on the COA for that batch. And so rather than if there's just a package that has 100 milligrams, making sure that there's something that has that amount of THC that actually that batch tested for.
G is fine. Can you clarify the intent of H?
H comes straight from statute. So there was 2646 that changed terpenoid potency to just type in concentration. So
we need to itemize the terps that are included in that product. Is that correct? It's a difficult proposition if that is.
So, and Lee, do you want to speak more to that? Because I believe you've been part of those discussions with terpenoid type and concentration.
Well, I wasn't thinking in terms of
Packaging and labeling.
packaging and
Okay.
labeling. The question put to me that it makes more sense to say type of concentration rather than potency.
What is concentration if not potency?
That seemed to be misleading for a few people in that it would be reported differently by different places. Sometimes we'll say percentage, sometimes we'll say milligram per gram, sometimes we'll say parts per million. So we're trying to lead towards a more standard unit of measure.
I have seen that. Sometimes it's percentage, sometimes it's milligram. So I think that there does need to be uniformity there. My concern with this H is that the way I read this, terpenoid type and concentration, meaning an itemization of all the terpenes that are included. And I can tell you already that we're stretched pretty thin on our 2x1 label to include all this information. If we were to list the terps and their percentages, we would not be able to include this product has been tested for contaminants, for example. Like, we would have to eliminate others in order to be compliant, or double our stickering, and then the whole thing's stickered, and then what are we hiding underneath? Is it going to be a compliance issue? The packaging underlying the stickers, it's I think that would need some clarification, but if it comes straight from statute, do we know what leeway we have?
So there might be more leeway here as opposed to in the testing section. So if you want to make a recommendation there,
I would say we modify H to be the total terpenoid content of the underlying product, and then I'll defer to you on the presentation of that, whether it be in milligrams or percentage or what have you. Percentage is what I typically see more frequently lately.
So you're making a motion for H to read total terpenoid content?
Correct.
Okay.
And then in the manner prescribed by the authority, meaning percentage versus milligrams, or et cetera.
So total terpenoid content in a manner prescribed by the OMMA. All right. Motion made by Blake. Oh, questions?
Say something. Oh, I thought she was going to click her button.
I was just going to suggest, Blake, that patients need the separation of the terpenes, and you could, as an owner of a dispensary, put a QR code or something on there that they can read that with.
That's exactly what we do. We have QR codes that go to the testing, which includes all those. We also, on the product display, we include the 3 primary terps just in their browsing. But that QR code is available where they can get the actual
You're talking
COA.
about running out of room, and I get that.
Yeah, it's simply, like, I agree that this needs to be there. It's simply a function of, can we fit it on our 2-inch sticker?
They would have a full, good gracious, 5 pages of every product that's in there. I know the ones we get are 5 pages long. I'm assuming most everyone is.
Most people provide that to the patient. I don't know that they're provided access to that in the statutes, but we do and most do.
And I know we keep ours on Google Drive so that we have to.
Exactly right. Yeah. Exactly right. Via a QR code, it's exactly how we do it.
And then we just provide those to the dispensary so that at any moment they can pull their iPad,
Yeah.
laptop, or anything, and just provide it to the patient or print it off and hand them a hard copy as well.
In most cases, the COAs are readily available, or they should be, in my opinion.
So should we also add something that says terpenoid type shall be readily available for consumer? If not, since we're asking that to be removed from the label, making sure everybody has that.
To clarify, I'm not requesting it be removed. It just, terpenoid type and concentration. Type implies that you would need to itemize. So the recommendation was to change this to total terpenoid content in a manner as prescribed by the OMMA.
So then the further,
Have the flexibility to do that.
so then the further information would just be the product going beyond what's required.
Correct.
Cool.
Okay, so that's Blake's motion. Do we have a second?
Second.
Second by Michael. All those in favor say aye.
Aye.
All those opposed say nay. Okay. Then we will put the recommendation down to change it to total terpenoid content as prescribed by the OMMA, with the understanding that the type and concentration are accessible to patients who ask for that information.
Before we move too far, I wanted to go back just above that. I believe that is G. Right. THC potency. I'm sorry. That would be E1G, the one just above the terpenoid type. And there we go. THC potency on the COA for that batch, that would indicate that it was total THC. Is that correct?
Yes, that's correct.
Okay. So we're not distinguishing between Delta 8, Delta 9, Delta 10. We're just going to put total THC regardless of the variety.
That's correct. On the label, the COA would have those separated out, and those results would be there as well.
Okay.
I guess that would be analogous to putting total terpenoid concentration on the label itself.
Okay, let's move on to page 82. I believe that's the next one. There we go. Getting into research and development. Cameron?
Okay. So this addition is specifically to add a allowance for R&D testing. And so we've kind of lined out the process between A through D. If it's a passing R&D test for R&D, it shall not constitute a pass for the purpose of compliance with required testing under these rules. So the big one that we would really like some feedback on here, though, is B. And so currently how it's written, it states that if a sample is submitted to a laboratory fails an R&D test, the grower processor shall comply with the retesting or remediation and or decontamination procedures under the rules prior to being placed into a harvest or production batch, if not already done so. And so I don't know if y'all want to discuss that, but it's just going ahead and specifically allowing that R&D testing.
Why would it not be considered if it was an R&D test and the test passed all, the batch test passed all testing? So then the processor made some product out of it that then has to be tested as a final product. Why would the rest of that batch not be considered to have passed for purposes of testing? Why would it have to be tested again since it's already passed as an R&D? I mean, as far as I'm aware, the test criteria, the number of tests, the type of test are all the same. So why would there need to be an additional test?
Well, this was certainly something we were hoping to get some pretty good feedback and questions from the board on. We did a lot of looking around what other states state. Frankly, not that many address R&D testing. But basically those that do are fairly explicit that R&D testing is not to be used or confused with compliance testing. And of course, there could be a lot of circumstances where you may not be ready yet to utilize that result. So we put this together, and quite frankly, we were hoping to get some discussion and feedback and try to come to something that makes pretty good sense in feedback from yourselves.
What's the difference? What's the difference between an R&D test and a compliance test?
A compliance test would be something you submitted that you are ready to sell or transfer that batch. An R&D testing, in my mind, you may not even have created your batch yet. You're just checking out something in your process to see whether something is or isn't what you would expect it to be.
Is that currently disallowed? Like, what would prevent a licensee from doing that today?
That's part of the issue, is that we haven't really addressed R&D at this moment. That's kind of why we're inserting it in here now. We don't have an express prohibition against it. At the same time, we don't say it's something permissible to do.
I can tell you that you're not going to get any R&D tests. This is a may, and it's an expense, and it's not currently disallowed. So I mean, I can't speak for growers and processors, but I would be very surprised if on a whim a grower decided to R&D test something that they have to pay $300 a test for that they can't effectively use and run the risk of, having it fail. Not to say that this isn't needed, but I'm just unclear on why we're adding it in as a separate type of test when couldn't they just go get a test period already?
Am I right that the R&D test isn't reported if it's a failure for something, and then obviously the full test is? So I think that saves a lot for people that are trying to, I guess, figure out if they're making a concentrate. Have we pulled all the, alcohol or ethanol out of this, and, go back to the drawing board where you guys as OMA don't have someone that has 40 failed tests coming at them from that trial run. Is that right? Is that what these R&D tests are doing?
Yes, Mr. Henshaw, that is correct. Yeah, the thinking is not that somebody would submit a full 300 full panel just in case. They're checking out parts of their system to see if there's something that they still need to further process, take whatever steps they need to, so that when they are ready to submit a batch for compliance testing, they're more assured that it's going to pass.
Okay, it makes a little bit more sense now you said that. So it'd be like if I had a small batch and I sent it to test and it passed, then I could easily move that into production and get it out on the market. But if it failed, I'd have to go through these remediation steps and then try again. Okay, that makes a little bit more sense.
So this is the grower or processor identifying this to be an R&D test, theoretically.
That is correct.
Why would they do that, I guess is my question. Is it cheaper in some capacity? Because with B they're gambling. Like if they get a failed test back, they have to put it into remediation. I mean, functionally it's the equivalent of getting a normal test, yes?
Let me give you a couple of scenarios. There'll be people that are wondering whether they're going to fail for mold. So they'll submit simply for mold testing. And then if that passes, they're not going to worry about the whole batch failing for mold, and therefore they're only encountering the cost for that mold. Or again, in a processor's case, have I pulled off all of the butane? So they'll submit a sample just to see if there's any butane still in there. It's good, then they can submit for the full panel rather than have that batch fail. They can actually address the fact that, okay, we need to, all of this that we've made in this production run needs to be processed a little bit longer.
But I guess I'm still wondering, if the test passed, if it's the same test, why would they need to test the same thing again that's already passed?
That is one of the things I would hope we would debate. Again, I just went out to see what other states are doing, and that's in there. I would like to, I appreciate the debate over whether or not that really should be in there.
I don't know about all testing labs and how they charge and all of that, but suppose a grower tested for mold and it passed. So now they have a batch of, I guess depends on whether they're going to the dispensary or to the processor of either 15 or 50 pounds as the case may be. So now that one batch is okay for mold. So they send it for the remainder of the test because we know it already. How would that be different than sending it all the first time? And then they still have to test all of the other batches that come through. But at least, like you say, they know now they don't have mold. Or conversely, if they do show mold, now they know, okay, there's no sense me sending all that to testing. I need to send it to remediation. But either way, if it fails, it fails. But once it passes, why would we need it to pass again? I guess that I just don't understand why we would want to test something twice for the same result.
I understand that. I appreciate that. I guess one question that I would have, quite frankly, it doesn't occur to me how this could be done, but how could the ability to use an R&D test that passed, how could that provision be abused? And therefore, we need to be on top of it a little bit.
I think that's a fair point because, I mean, it's in the language here that they have to indicate on the COA that it's an R&D. And we've got here that it shall not constitute a pass for purposes of compliance testing. Was there a request for this? I guess I'm just unclear on why we need to provide for this when it's not disallowed already.
It's been an internal discussion. I'm in favor myself of all the R&D testing that the industry needs to do to feel good about what they're doing, learn about how their processes work. It's kind of come up in the concept of discussing seed to sale. Some of the back and forth that has been had within the department has been that we don't specifically allow R&D testing, therefore we probably should put that language in our rules. So that's kind of where the genesis of this language came from.
And just for my purposes being new, what is research and development testing?
In essence, it's product development testing. You're trying to learn something either about whether you're a grower or a processor. I'm expecting X. Am I getting X? That kind of thing.
So this is more of kind of the educational or research side of the industry, kind of.
That is correct. That's to understand and learn more about your own internal processes.
Then I would propose if this is intended to be for exploratory, fundamentally R&D testing, then why are we having negative implications happen on a fail? If all they're doing is sending it to testing for their own internal R&D purposes and, for their own information, I don't think there's anything wrong with that. But I don't think that the exploratory test, the results of that should impact for the, positively or negatively, the person who sent the test. If really it is intended to be an exploratory test, then I would say that these failing R&D test results, even though it's an R&D, that will kill that product because inevitably that will be known that it failed an R&D test, even if they've been to remediation, even if it's now okay. It would be prejudicial against the person getting it tested. And if our intent here is to encourage people to do exploratory testing prior to compliance, then I don't think that we should penalize that in any way. As long as the COA is clearly marked R&D purposes only, not to be used for, compliance verification, what have you, I'd be perfectly fine with that. I just don't think that we should penalize people if that is the intent. What's your thought?
I am in agreement with everything you just said.
The key is, though, if it's R&D, is it intended to never go into commerce at that level? It's just, hey, we're going to do a test run, make sure our process works, lose some money at it, but we're getting it ready, and then we're going to go full on with the proper process and get it tested normally. Is that
Yes,
the
sir.
intent? Okay.
Yes, sir.
This would be very similar to what happens in the food world. If somebody were making a salsa or something, they would do a process analysis, and that tends to cost substantial money, but it is part of investing in your business and expanding out your products.
And also, like, I know Brian's not here. He'd be better to speak to this, but I know that testing labs, there's a finite set of customers, and they have difficulty, pinning those down. So if this would open up a new revenue stream for one of the license types, then I'm all for it. But my reservation is with penalizing that effort. If the intent is to, encourage it, then we shouldn't be punitive in how we address it. What do we think about just removing B and C? Would that accomplish your intent without creating a situation where a licensee is penalized?
I think C is worth keeping because that doesn't necessarily go out to the public.
Only reason I included C in there is because of the ambiguity with the inventory tracking system. What does that look like today, So what are they documenting and who are they identifying it to today?
And so maybe that's a question for clarity. Does documenting mean Blake sent it to lab X and all you have to do is document it went to R&D, or it was an R&D sample, or is there additional paperwork that has to be done on the back end?
So I think that will be just like any other thing that you transfer, though, just for testing, making sure you have your documents, and then also it's identified in the metric system. But to go back to B, my only thing would be to recommend, as you are discussing this, maybe not just completely crossing it out, but making it clear to to not penalize if that's your recommendation, because that way it's still clear what happens with a failing R&D test as opposed to just completely removing it. So I would just keep that in mind as y'all discuss that.
By definition, requiring them remediate is punitive in nature. Is it not?
So if you have a failing R&D test and nothing changes, no. Then you would still go through compliance testing.
Well,
so I would just clarify
per
that.
B, it says you have to remediate.
Yeah, currently. I'm just saying in your recommendation rather than just striking it completely out, just because we're dealing with passing R&D results and just making it clear what happens with a failed test result, because that'll be.
So what would happen in that event? It would just be reported to the state tracking system?
That's what when y'all discuss this for your recommendation. But
I still think the neatest way to do this is kill at minimum B, if not C. And the reason I say include C in that is because I believe that laboratory reporting in D is a redundancy of C. The lab receiving the result is under a mandate to report. Why would the grower and processor then also have to report?
again, there's going to be more documentation in just the COA.
If I understand kind of what Mr. Capps is saying, is because in A, it talks about a passing result. You want something that discusses the failing result. Otherwise, it'll be kind of unclear, I guess. Is that what you're saying?
That's right.
I would agree. It might not necessarily be the current language, but I think there does need to be something that tells somebody who's reading these rules what happens with a failing result. Otherwise, it's kind of out for interpretation.
What if we were to keep everything up through laboratory fails an R&D test, comma, and then we put section D at the end of that, strike the rest. So it would read, failing R&D test results if a sample submitted to a laboratory fails an R&D test, laboratories shall clearly note in the state's inventory tracking system and on any COA created for an R&D sample that the test results are for R&D purposes only. Would that accomplish what? Okay, so basically, I'm
Okay, so what is the purpose? Let's go back and just think about what is the purpose of having an R&D section and testing anyway? What are we doing? I mean, clearly it's not intended to be the final product that goes to customers or consumers, I should say. It is intended to do something else. It is for another purpose. So telling consumers that this sample 3 generations back had some issue with it that has been remediated over the course of 3 iterations now, what good does that do the consumer, the industry? How is that helpful to anyone? All it does is stymies and stifles the willingness and ability of an innovator in the industry to move a product line forward. Because who's going to if I'm going to invent a new gummy bear, why would I do that if, the 5 iterations later now I'm going to have to tell the world, well, the first 2 I did weren't very good and didn't pass testing. Now the world is going to see that and go, well, why would I buy this? Because now we know it's been messed up in the past. So the whole point is to allow innovators to move the industry forward, to do product development and research, development, and testing without the fear that the results of those tests will become public and then therefore damage not only their product lines, but maybe their brand name as well. I mean, this could be serious damage to a brand if these early iterations, the results of these things get out. So I think what we want to do is encourage that by making sure that these tests are not mandatory that they be provided to the public. Once the final product is tested, we want to make sure that final product that is used by the consumer is 100% safe and effective and the correct dosage is there. But all of the iterations getting to that point, I don't know that we need to make that all public.
So I'll just add to that. So anytime you have a transfer in metric or the state inventory tracking system, it's going to have some type of tracking. Those records are confidential and not subject to open records request.
Right. And that's with a transfer from one company to another.
Yeah.
That's not an innovative process within the company where they transfer it from the R&D division to the product development division, or perhaps they bring flour in and move it over to an R&D division who's developing a product who then keeps it within the company and then sends it to testing to see what those processes have now produced. And I don't know how many times Thomas Edison failed with a light bulb, but if he were required to tell that to the public every time, would we have light bulbs today? I don't know.
I mean, to your point, I think just the risk of confusion is very high. Not only with the, end patient, but also within the industry. Because as well as I do, that outside of this table, not a whole lot of actual OMMA licensees get into the thick of it with these regs. And they may not understand the implications of this or what even an R&D test is until they see one, in which case they're asking questions. Is this a fail? Like, must I now reject this? I mean, I think that it's a good thing to provide for it, but to create a whole separate classification for it in this way is risky. Because, as I said earlier, and as Mike's point, it gambles with the brand as a whole. And even though it is an R&D test, if that were to get out to the public, even though it's confidential and not subject to open records, doesn't mean it's a lab attendant's not going to tell somebody. And that could be incredibly detrimental. So there's a pretty high risk of negative implications here. And when weighed against the benefit, I don't know that it's warranted, especially because it's not disallowed currently.
Or so if the processor or the grower were to name it as an R&D at the start, and then no matter whether it passes or fails, it just doesn't go into commerce, would that be? Because then it's all confidential at that point.
Well, as it's written, that effectively would be the case on a fail. But my concern isn't necessarily the product, because it's theoretically never intended to get into the stream of commerce to begin with. My concern is that that test gets out and people misunderstand what that failure is. And that can ruin a brand. So high risk, low reward in my mind here. I'm not opposed to the concept, and I think it opens up a revenue stream for the laboratory license type, but anything punitive surrounding it, and it's just tough to implement.
And Ed, back to your question, I've been sitting here the entire time trying to think of how you could abuse this. And of course, now it's only been 5 or 10 minutes, and so obviously I've not thought this all the way through. But I'm struggling to find a way that if it's an R&D, how you could abuse it. You can't. If it fails, you can't put it out on the market because you have to retest it. You have to remediate it and retest it. So consumers can't be placed in jeopardy. I'm just struggling to see how it could be abused. I suppose someone could use it just for a test to see if they have mold or residual solvents, without testing the whole batch. But if it fails, they remediate, they come back, they retest. If it passes, even if they just retested for all of the other things, microbials, etc., it still passes. Consumer is still protected. I mean, at this point, I don't know how it could be turned to endanger the health or to cheat, I guess, is maybe the simplest term to use. I don't know how it could be used to cheat.
So we have a formal recommendation.
Absent.
What was yours, Blake, to remove?
Right. Earlier, I had proposed, and the alternative, I think we just strike in its entirety. But initially, I had proposed if a sample, starting on section B, basically we are supplanting section D after the first sentence in B. So it would read, failing R&D test results. If a sample submitted to a laboratory fails an R&D test, then we skip down to D. Laboratories shall clearly note on the state's inventory tracking system and on any COA created that the test results are for R&D purposes. That way it clarifies that failing test is intended to be only for R&D testing, but I still think that the risk of confusion is high. So that would be my recommendation, and the alternative, striking it in its entirety. I think, the intent is 100% I'm on board. It's just the way that this is crafted, it's risky in practice.
And with A, you're still comfortable with A?
Yes, because I think we're all in agreement that this is not intended to be a compliance test. So even if it passes, this just clarifies that it is not a passing for compliance. This is an R&D specific test, if I'm understanding correctly.
Are there, I guess, if it's the same test, why would you?
I don't know that it is, though.
It is.
I think it could be a lesser test, testing for only one thing as opposed to the whole panel.
Okay, correct. So you could do that. But yes, if you only tested for one thing, let's mold. If they only tested for mold, no, that's not a compliance test, but they could do the rest of the compliance test and use the mold in the R&D to fill out the compliance test. Does that make sense?
It does, but my understanding of the intent of an R&D was it to be kind of on an island. Is that
But
correct?
once it's passed, it's passed.
So
I think that's a separate conversation. Go ahead.
I was going to say, my thought with that is then do a compliance test and don't do an R&D test.
That's what I was going to say.
But you want to make sure it passes first because you have many, many batches and many, many tests. So you want to make sure it passes, and then once it does, pass for mold.
My general understanding with R&D is that you're using a very small subset of whatever it is that you have going on. So you wouldn't necessarily have, your entire operation focused on this thing you're developing. So yeah, I mean, I would say if you're doing a compliance test, do a compliance test. But if you're looking at mold, milk, whatever, imperfection that may be there, utilize the R&D process.
In theory, anything short of a full panel compliance test would theoretically be R&D because it's not intended to be a compliance test and utilized for that purpose.
Yeah, and on my part, I'd have trouble being able to get the bonus of what's in A without getting the possible penalty of what's in B. Because if you're going to get one, you got to have the other.
I mean, I think just
So you're
simply the amount of ambiguity and discussion around this, I think we should just strike it because it's not currently disallowed. And again, going back to, I think, my first comment, I don't think you're going to get a whole lot of takers. It's an additional cost that is unnecessary. Providing for it is great, but it's not currently disallowed.
Do we have a second for your motion?
All right. Motion to strike 2.
All right, Blake has made a motion to strike the entirety of section 2 that's on the screen right now. Does he have a second?
I got a second. Oh, go ahead.
Okay, we have a second. All those in favor, please say aye.
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 All those opposed, please say nay.
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 Okay, the motion carries with 5 ayes or 6.
Should you all not choose to take that recommendation, I'm presuming that you understand the concern. You kind of know where we're headed with it. Okay. Opens up a revenue stream for a lab, which they're having a difficulty with to begin with. So I'm not opposed to this idea whatsoever, to be clear. It's just the risk-reward balance isn't there yet.
Did we go anywhere with your other recommendation, combining B and D by chance?
Could we propose that as an alternative should the OMA determine to not accept the original striking?
I will second that one.
Yeah, I mean, I think that's fine. So in the alternative, if we don't
Restate
strike
it.
the entire section, we would strike section 2B after the word
Test,
comma, and then pick back up on
Plug in D
section D.
there. So striking everything after test, comma, and striking C.
Correct.
Was my original.
Yes, I think I was tracking on my document. So it would read, failing R&D test results. If a sample submitted to a laboratory fails a R&D test, laboratory shall clearly note in the state's inventory tracking system, et cetera, et cetera.
Yeah, that way it protects the person receiving the failing result without making them send something exploratory to remediation.
I'll second that motion.
Okay, so we have a motion and a second. All right. Those who,
So I assume you have this motion to strike, and if not struck, use this language. Is that?
In the original the original motion was to strike. In the event that OMA determines not to accept that recommendation, we propose the alternative.
okay, I think that's fine. I don't know. I think we should still vote on it and just make sure that everybody here is comfortable with the alternative. Okay, so any discussion or questions on that, since it was a little, okay. My brain's getting a little foggy. All those in favor say aye.
Aye.
All those opposed say nay. Okay, the ayes carry it, so we have an alternative if the section is not stricken. And let's move on.
All right, the next one I have is on page 90. And it's A-1R. So we added a number 3. Go down a little bit. There we go. So this essentially just states that if a harvest batch fails for microbial testing and water activity, you don't have to do the remediation or for the water activity. So the harvest batch does not need to be further dried and cured by the grower before being transferred to a processor. This is because you don't need that additional testing when solvent-based concentrate production will remove both concerns. Anybody have any discussions or concerns? Hearing nothing further, we're moving on.
Hearing nothing, let's move. Okay.
Okay, the next
Page
one,
91.
this is page 91. So we have removed under A-2C proficiency testing. The reason we remove this is because proficiency testing is a confusing term when you also look at accreditation and the fact that they use that term. So we changed it to external quality control program testing. It's essentially the same thing, but just rewording it so it's not confused with accreditation proficiency testing. But we did add new sections under this chapter or subchapter. And so essentially a result outside the target range of any analyte in this testing event shall be deemed an unsatisfactory result, and then each unsatisfactory result shall be evaluated by the licensed laboratory and corrective measure identified. So, and Lee, I'm probably going to go ahead and just pass this one off to you because this is 100% within your laboratory area and kind of what we're trying to achieve here. So as far as unsatisfactory participation in this program and what that looks like.
The intention behind this whole section is to make a little more stringent the testing capabilities of each laboratory. Under accreditation, you have to participate in a proficiency testing program, but for OMMA's purposes, I don't believe that's adequate. For instance, you only have to cover the scope of your testing in a proficiency testing event once every 4 years. So 1 year you could do heavy metals, 1 year you could do pesticides, 1 year you do solvents. And so it'd be 4 years in that span between when you last had an external quality check on your testing. So we've created an in-state program that does a similar kind of thing, but much more frequently. And we're also putting performance standards within this, in that anytime you fail to achieve the target value, that would be considered an unsatisfactory result. Basically, it says you missed it. And it's incumbent upon you to evaluate in your laboratory why you missed it. Now, if you miss more than 20% of the analytes in any one particular event, that's considered unsuccessful participation. Basically, you got to score a B or better. And if you don't have if you have more than 2 unsuccessful events in a row, or 2 out of 3, not more than, if you have 2 unsuccessful events in a row or 2 out of 3, then you may be subject to additional measures by OMMA.
Two quick questions. One, what agency will oversee these? And if you wouldn't mind answering that one first.
Very good question. The quality assurance laboratory that's contracted with us actually has ISO accreditation to administer a program like this. So they will be the ones that administer it. OMMA will be the one that reviews and makes sure each laboratory is meeting the requirements of this rule.
Just out of curiosity, who is the QA lab?
Their business name is Demeter LLC, DBA Metis, METIS.
Is this language taken from other states or?
This language comes from my experience in the clinical lab testing world. This is pretty much exactly what I've had to adhere to as far as external quality control, proficiency testing for the last 40 years.
Thank you.
Just to understand better, so you guys would basically take one of the COAs that they had put out in the past, do your own test on that sample and gauge whether they're greater or less than 20% difference?
That's a good question. That is not this program here. We are doing that, but this program in particular is where the quality assurance laboratory will create a sample large enough that each one of the labs gets exact same thing, and we measure how close they come to a target value and what the spread of results are.
My other example is being done, though, right?
Yes, we're calling that parallel testing right now. And we've been doing that for several months now, where the quality assurance lab goes twice a month to each laboratory, picks up samples that are held in reserve, and gets the COAs that go with those samples, and we compare the QA lab results and the licensed lab results.
I'm fine with this. I'll defer to your expertise in this matter. I think it's worth noting, though, that the way, as I said earlier, I'm all for allowing labs another revenue stream, but essentially this effectively being a capitalist enterprise, I could say, in terms of labs, there is a incentive for a lab to give higher THC percentages because there is a finite customer base. Is there essentially just gamesmanship with your test results is prevalent and a concern? Other than the parallel testing, is there anything else being done to cross-check that?
We've included this process here, just almost finished with reviewing the data right now, specifically for THC. So this would be part of that. We also are evaluating the variability between each laboratory and the QA laboratory in this parallel testing, and gauging who's really close and who really isn't. Those that are off, we're conducting consultations with them. If it's a routine thing, then even after we've talked to them, then that may involve us going on site, looking at test data, actual data, that sort of thing. I know that's outside of the realm of what we're discussing here, though, but those are good questions.
So just one more question. Because my background's more in water quality labs and 20% seems really high. What is kind of the confidence that most labs, could provide, as opposed to having, we talked earlier about the 15% higher or lower, and now we're at 20% unsatisfactory results? That's
a good question. It's not that you're 20% off of your target value. It's that you missed 20% of your answers.
Okay, thank you.
Is there any other discussion on this section? If not, we'll move on. Okay, the next section is on page 93.
This basically is what it's saying. There's a fairly high turnover at the laboratories right now, and people that we're used to interacting with may no longer be there. One of the reasons why we would like to know this in a short amount of time so that we can verify that that person meets the qualifications to be a laboratory director.
I think I might have made this recommendation last time, similar to where we had just days in there, and I would recommend we do business days. And then I don't know if is seven a normal number. I know for our doctors, what we tell them is if they change their address or they move their practice, they've got 14 days to tell us. Is 7 normal for a lab? I don't know if that's kind of quick or not.
There's no normal for that.
Just for reference, do you know what DEQ's requirement is?
I do not. You mean for notifying with somebody? I do not.
But that is something we can look into, Adam. I think that's a good idea.
I don't have a particular recommendation. I just didn't know if it met any sort of industry norm.
But on the flip side, if somebody notified you on day 9, that's probably not going to jeopardize your license.
Oh, no.
Yours is going to be like.
I just say, tell us quicker. Yeah.
Yeah.
Shall we move on?
Make a motion to change it to business days.
Okay, so Michael, you're making a motion to change it to 7 business days?
Or can we do 10 business days? So it's an even, I don't know if 7 is kind of a weird number for business days.
Okay, 10 business days.
Or 5, either 10 or 5.
Did your prior recommendation to take days to mean business days, does that not apply here?
I would possibly think so, but I don't know if we were talking about emergency rules or permanent rules last time I did that.
I think those are emergency.
I'm already seeing in the next section another day. You might as well open it up to everything. I'm already seeing a day mentioned in the next section. You might just open that recommendation up to everything.
Gotcha.
Yeah.
I'd make a recommendation that any time we use days, that we use business days.
So that's what I think we covered earlier. Cameron touched on it at least a bit, right? That if it just says days, it's inferred that it's calendar days. Otherwise, we put business days, right?
I would say we do everything as business days.
I think there are a few things that statutorily.
Right. So there's going to be a couple of things that we cannot do business days on that come from statute, but also we have NOVs that have the 30-day requirement. And so, but as far as not statute or other requirements, then we're fine. Go ahead and do that.
Works for me.
So, Michael, what is your recommendation? Changing it to 10 business days?
Yes.
Okay. Do you make that motion?
Yes, I make that motion.
Do you have a second?
I second.
Those in favor say aye.
Aye.
Anyone opposed, say nay. So,
I want to ask a question, and it's back up a little bit, and it's on the bottom of 92 and the top of 93. And that gray, that's going to be the emergency rules, correct?
That's correct. That's something that was removed from statute.
Okay. I don't want to get too deep here, but I want to ask the question to see if this says what I think it says. So an owner of a laboratory cannot own any part of a business license, any other business license, right? That's in D. Then we've stricken that to say that indirect beneficial owners can own interest in a lab and interest in a marijuana business license, just that their lab can't do the testing for that marijuana business license. Is that what D says at the bottom of 92 and the top of 93?
That is correct.
Okay.
Okay, and so we will have we'll have another.
Right,
yeah,
I didn't want
okay.
to delve into it. I just wanted to make sure I
okay.
understood what that said, if I understood it correctly.
Okay, so it looks like we are on page 93 again in section G, equipment, G1. Seeing no comments, let's move on. Thank you, Lee.
right.
And I've been informed that we have a lab set up in Oklahoma that other states are looking at because ours has done so well. So we definitely have a really good lab program. Thank you, Lee, for all of your hard work. Page 95, section K.
Okay, so essentially now we're requiring that within 30 days, an accrediting entity's assessment, those results, findings need to be reported to us because this is information that we need to know, especially if they've lost accreditation to test for specific analytes and also if they just failed that test in general. So,
Actually, can we add calendar below before 30 since that's meant to be a month?
I will go through and put business
Just to
business
clarify
days.
with his.
Thank you, Mr. Capps.
Welcome.
Presumably, this is all standard.
Turn on my mic. Section L is something that we've learned that we needed to have in there. But the language in there is quite standard. Good laboratory practices addresses this very similar language in any kind of program you look at, FDA, College of American Pathologists. It's pretty standard language.
Okay, seeing no comments about that, we'll move on to the next section, which is on page 101.
And Lee, I'll let you talk about this one as well.
One of the things that we've learned in our audits where we've gone out and visited laboratories that is a little bit unclear for the labs. Of course, they have to achieve their ISO accreditation, but again, there's been occasions where we have felt like that was not adequate. In particular, with what's known as method validation, you need to conduct studies so that you can verify the accuracy, the precision, so that you know exactly the plus or minus on any result that you can expect to get. The sensitivity, which is in essence the lowest quantitative number you can get. Crossover studies, if there's some other compound that looks very similar on your chromatogram, that you make sure you identify what interfering substances may lead to a false result. Linearity, can you detect accurately at the low end of a calibration curve as well as the high end, and make sure any result in between the low and the high end are on that curve. There's not something that would cause it to bias to bump it one way or the other. And then measurement uncertainty kind of sums up also the sensitivity and precision, so that at any given level, you know that that result is that result within plus or minus X percentage of the result. And so we felt like having this in there for when we go in and do our audits, the laboratories know exactly what we're expecting to see when we come in there.
Is method validation the same as process validation, or
No,
are those
it is
distinct?
not. Well, I guess in general terms it is. Method validation regarding your own particular instrument is validating that process. However, in terms of laboratories, it's simply, in this context, is what your instrument capabilities are. If we were to look at true process validation for labs like we're talking about elsewhere, we would look at everything from sample intake to reporting the results out, the whole entire process. This is just limited to the analytical portion of testing.
Quick question. From your point of view, is it worth putting including but not limited to?
Well, that would give us room to deal with anything else we decide we may need to look at some point. That's a good point.
So I would recommend adding not limited to after including and before accuracy.
Okay. It's a motion.
Second.
Second. All those in favor say aye.
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 Opposed, say nay. And Norma just came back in, so I'll just loop you in what we're doing. We're just adding on J, including but not limited to. Do you want to vote on that?
Yes.
Thank you. Okay, moving forward.
So the next change we have is something we've already talked about in the commercial licensing area. As far as the $500 material fee, and this goes into the waste, and so anything that's been added into waste is essentially we've already discussed here. Let me know if anybody has any concerns.
Actually, since this is repeated at least twice, I think actually 3 or 4 times, is there any way in the next version to maybe, it seems like duplication of language, which I'm not, I know I'm talking to you and you know all the other, all the other codes were shrinking down, but this one, it seems to proliferate the same paragraph throughout it quite often.
Yeah, I agree, but how our rules are set out currently is research and development, so you have to put the requirements there
so
for those
it's per-
specific license types. Then you have
that
commercial
makes sense.
or marijuana businesses.
Okay.
And then you have
It's just
waste,
one thing
and
that
that's
bugged me
why
because
it's like, but I agree.
I was reading through it and I was like, I've read this page before, so I thought I'd printed up like 2 copies.
But I think that's a good point. If there's
No,
any
I-
opportunity for brevity, we will absolutely
I
take
think
it.
it's something that's needed too. Okay, so I think that's all the changes that we had. But before I forget, I wanted to go back because there was a recommendation that we had as we were going through the what happened last time, as far as yes. And so if we would go back to 5-6,
Hold on, I do have one thing here.
Okay, you do have one thing.
Licensees shall obtain department approval prior to any material changes, meaning that we need to get your approval before we move or change ownership.
That's correct. That's how it's always
Before.
been. So you can, so for a location change, you're gonna have to get a COC, you're gonna have to have these other things that you need to have approval prior to moving the location before you.
Sure, but making that a prerequisite means that, say I were to go purchase a dispensary, I would have to get your approval for that purchase first. Is that what you intended?
It's for the location change and then ownership change before you make that ownership change to get that approval, because that ownership percentage can change your residency requirements. And so it's making sure that you're still qualified to have that license in the first place. So you need to do that on the front end.
Meaning that I can't close on acquiring a dispensary without OMA's nod.
So meaning that you have your business requirements, but for the license, before you change locations and you have a new location, you need to get that approved prior to.
Can we change prior to just say for? Do you see what I'm saying? The way it's written, if I were to acquire a dispensary to expand, I have to have your approval before I close that deal. I think your intent is to make sure that prior to you accepting the transfer of the license or to making the accepting the material change request.
I got you.
You see what I'm saying? Prior to means we have to hold on for OMA to answer, which ain't quick, to close the deal.
Okay.
Can we change prior to for?
Make a recommendation.
I'd like to make a recommendation to change prior to in section 2 to read for.
I'll second that.
Motion and second. All of those in favor say aye.
Aye.
Those opposed say nay. Okay, ayes have it.
All right, what were you saying?
Thank you. So just wanted to make sure, I didn't want to forget your recommendation earlier, that when we were going through with the reconciliation of the inventory and the previous changes or requests for changes, when we first started this discussion, there was a recommendation there that we said we would go through once we were going through the permit rules.
Oh, yes.
Okay.
Oh, good job.
I was like, everyone's looking at me. I'm like, I swear. We all said we would come back to this.
Thank you.
What is it?
Hold on, you say it slower.
Oh, and then below that, what page number?
Will you say it slower? More slowly.
I think.
I'm here.
What the grammar is. 310-681.
Oh, -5-6D.
Yeah.
Yeah.
Did you put? I did.
Austin, do you have a page number?
So I have it on page, if we want to go to the medical marijuana business, page 65 is, so. Because I think we were talking about 5-6F 1 and 2. So they are not highlighted, but I just, since we're talking about the permanent rules, though, and you made this recommendation. I was hoping you were going to refresh me. I just right. So I think it was just purely about the ensuring that the reconcile made sense in light of if it's not the live reporting. That you don't have to do necessarily the double reporting, the reconciliation.
Did I make a recommendation at that time? So I don't have to read it?
I thought this was the one that we're saying that if you met one, then by default,
Right.
you would meet two.
Yeah.
Okay.
Okay.
Yeah. So maybe just saying something to the effect of the end of F1.
I actually think this was Norma's. Was it Norma the one that brought it up? Per Austin's notes back here, it says Norma says there's any sort of way for transporters to carry extra inventory with them right now, and Cameron and Adria said, okay.
Oh, that's a different one.
Oh,
So there's two things we need to.
All right, so I'm looking at F1 and 2.
okay.
Maybe we would say that at the end of 1,
Thank you.
4, in the absence of real-time reporting. 2. So it would read, a minimum commercial license will track, update, report inventory after each individual sale to the department in the state inventory tracking system, comma, or in the event that real-time tracking of each sale is unavailable or impracticable, 2.
I'm not going to lie, I'm not even on the right page yet.
I'm following you. And
It's the one right here.
Actually, that may change that numbering scheme a bit because it may push it out of the 1, 2, 3 scenario. If
We're just adding that phrase to the other one.
yeah, but just the way it carries through, it may mean something different on 3. So just so you may want to.
I'm going to be honest, what I'll probably end up doing is probably just kind of putting the language that you're saying in front of 2. And then, yeah, just make it work. But yeah, I want to make sure we get your formal recommendation.
Can you repeat the recommendation? Thank you.
So making a recommendation that under section F1 and F2 and wherever else they're duplicated throughout, that we change the language of 2 to read, comma, or at the end of section 1, and then into 2 in the event that section 1 does not apply, or something to that effect. That way you're capturing all scenarios without mandating that you real-time report and conduct inventory on a daily basis. But one of the 2 must be done. Repeat it again. You guys got it?
I'm tracking. Thank you.
Okay. And I would also propose that we add notwithstanding sections 1 and 2 above to the beginning of section 3, to Philip's point. Clear as mud?
We're good.
It makes sense. It's just, it took our brains all a minute to get back to this conversation, I think. But okay, so you've made the official motion to clarify this section. Do you have a second? Do we have a second?
Yeah, I'll second.
Okay. And those in favor of the recommendation say aye.
Aye.
Those opposed say nay. Okay, the ayes carry it. We had the section to talk about that Norma wanted to discuss earlier, and I tabled that so that we could talk about it when we got to this section. So let me get to the right one. Austin, can you remind us which section that is that Norma was discussing?
310-681-1-4.
So 62.
Cameron's our hero, page 62.
Okay. Do you remember your?
Yeah, so.
Because I think that's going to subchapter 3.
Could show up across the state, and that customer then decides he wants to double his order or something. Is there any way for him to be able to take extra inventory with him in case that happens? Am I right?
So
In case you're
that's-
unaware, this is happening.
Yeah, because that's going to go into a pretty good legal analysis, because typically when you go to subchapter 3, you have to have your inventory manifest. It can't, and so currently how it is it can't be altered other than the signature or the name, and so you have to have the recipient name and the quantity should all be there. And so I don't know if there's a method currently under statute for that to be the case.
There isn't at the moment. That's what I'm asking. We need to develop that.
Okay.
Maybe it's a different license and it's not called a broker.
Okay, and that might be the case because this would be more of a statute change. It's to kind of open that up, and so we might just want to take notes for a potential statute change.
Okay, so will you say it again, just so I can make sure I understand it as we start to talk about our legislative agenda for next year? Okay, I've got it, and I'll add that to our list of ideas to discuss for the legislative agenda, since that would need to be statutory. Thank you. Okay, so now we have completed the discussion about the proposed permanent rules, and we have taken minutes and notes on all of the recommendations, and we'll follow up with that whenever we normally do that, which I will figure out. But what we need to do is move on to new business. Do we need to take a final vote on the rules at this point? No. Okay, so new business. The only new business that I have is to look at a date for the October special meeting so we can go over the emergency rules. So we can have another day like this, but for the emergency rules that are required for that House Bill 2646. So Cassie was looking at some dates. Do you have any?
So just essentially any time in October. I don't know if you guys want to keep on with the Monday meetings.
Let's just try it and see what would work.
Okay.
Ideally, it'd be Wednesday through Friday.
Okay.
I believe Mike is also better Wednesday, Thursday,
Okay.
if that's in the cards. Well, I'll make Monday work, but I'm missing a meeting every Monday I'm here.
Okay.
So possible dates, October 20th. Is that giving you give time, Cameron?
I think if we could do it like potentially 1, 2, 3, 4 weeks from now, that would give us extra time to get it to the governor's office and give us time to formulate any changes that are recommended by this board. So possibly like the
13th?
Yeah. So October 13th, 14th, that looks like fall break for those who have children in public schools.
That is fall break for public schools.
Okay. Is the 13th fall break? Oh, it is. Okay. Then I guess we do need to look at the 20th. That would give us 1 week to get it to Audrey. She needs it by the 27th.
We should be able to do that.
Okay. Then what about October 20th?
Works for me. Do we need a motion on that? Probably.
Sure.
I'd move that we do our special meeting on October the 20th at 9 a.m.
Is this a full day again?
Probably.
Unfortunately, the emergency rules are probably going to be even thicker than the permanent rules. So
9 a.m.
So I think what we'll plan for 9 a.m. and we will hold whatever room we can reserve, hopefully this one, for the whole day, just in case we need it. So we have a motion to schedule the emergency rules review on October 20th at 9 a.m. The location TBD, we just need to make sure we can reserve this space again. Motion, do we have a second?
Second.
Second, all those in favor say aye.
Aye.
Opposed, say nay. Okay. And otherwise, is there any other new business?
Move to adjourn.
All right, second.
Second.
Surprised there wasn't
All those in
questions.
favor, say
Aye.
aye. Okay, we're adjourned. Thank you.
Thank you.